Right. During Fukushima, Japan, there was about 23.46% of the total casualties were people with disability. And while during the Hurricane Katrina in US, more than 73% of casualties were among persons aged 60 and above. As we know that the USA and Japan are both among the wealthiest nations in the world with sufficient capacity in managing disasters. However, people with disabilities are still significantly impacted by a disaster. As we know also, the availability, accessibility, and suitability of information that have been a global and common problem for people with disability. Our concern because of the lack of information and lack of access to the services has dominated the 9 causes of the most common problems that people with disabilities may face during disasters. And another problem is also lack of tailored communication systems that are accessible for people with disability and designed to meet their specific needs. Also, lack of appropriate information delivery methodology, particularly for those with visual and auditory impairments, has excluded people with those disabilities from one of the earliest and most crucial steps in surviving a disaster. Another problem as well is inaccessibility of many forms of emergency communications to people with certain disabilities. Okay, next slide. Those are the problems that we have identified. Now, let's have a look at that Indonesia with more than 17,000 islands, where most of people with disabilities are living on disaster-prone islands. And Indonesia has 34 provinces, at which each province uses more than one native language. So Indonesia is quite rich on differences on native language. So on the left side, slides, we see that the total people with disability population in Indonesia is counted around 200,000 and 6,000 people. And most people with disabilities are living on islands that are categorized as part of the Ring of Fire. So the database is based on the temansos.co.id. People with disabilities are less densely represented in safe regions or categorized as not within the Ring of Fire. While on the other hand, on the average, there are more than 23 languages used in each province in Indonesia. So let's say each province uses more than one native language. This trend indicates that native language is an important issue for people with disabilities. Meanwhile, Indonesia has ratified the Convention on the Right of Persons with Disabilities and is obligated to recognize the rights of people with disabilities to be protected from disasters, as written in National Law Number 6, 2016. Okay, next slide. Indonesia also rich in culture and diverse languages, which have a significant bearing on the success of disaster management. Let's say, for example, during Palu earthquake, 15th of October 2018 in Central Sulawesi, Indonesia, it is argued that the high numbers of casualties were at least partially related to the quality of disaster information delivered to the community. And feedback from the affected people indicates that the delivery of information was insufficiently adapted to the culture condition and native languages used by the local community. This finding was comparable to the study regarding the importance of disaster information to consider local culture and native language. So the weakness and the barrier that we have identified by using the word risk is not recognized and understood. Sometimes technical information related to disaster delivered by the current officials was not effective in conveying appropriate, timely, and relevant information in easily accessible local languages. Also, the word risk is not recognized and understood in the local language. So, however, there are also the opportunity that the local community is familiar with the word disaster. Local communities live close to nature and have experience from the previous natural disasters. The concept of disaster is translated into daily life, passed from generation to the generation through native language and packaged into folklore. In Palu, the word disaster has been translated into disaster folklore known as Kayori, which contains ancient poems about the past, including warnings about natural disasters. So based on this identified weakness and barrier and also the opportunity, next slide. Indonesia also, here we try to present the rich of culture, language, and folklore can be used as medium to disseminate disaster and pandemic information to the native people and especially people with disabilities. So as you can see on the left table, the native languages representing disaster, mainly tsunami in Indonesia. Let's say from provinces of Aceh, native language and the meaning several native language, for example, smong meaning that tsunami or giant wave. While the other location also have similar native language terms, which meaning have more or less same with a tsunami. And also in Ambon, Central Sulawesi, East Nusa Tenggara, and West Sumatra. So, and native folklores and indigenous knowledge representing disasters in Indonesia, including also in Java, Lampung, and also Central Sulawesi, while with disaster types, different disaster types, and the meaning and also the contents. Let's say, for example, in Aceh, we known as smong or tsunami. Smong means several actions that should be taken when tsunami happens. And also in Java, we know about Pararaton, mostly volcano eruption. And it has been contain a historical record of disaster events, mostly volcano eruptions since the year of 1233 in Java Islands. And also in Central Sulawesi, it has been known as a folklore and indigenous knowledge as Tagari Lonjo, or disaster types is liquefaction. So it is a set of rules not to go to the certain area that has disaster risk, mainly soil liquefaction. So those are the example amongst the rich cultures, languages, and folklores that use as a medium to disseminate disaster and pandemic information. Next slide. In order to reduce the vulnerability of people with disabilities, it is important that the information should be available in native language and made available in digitized format. So at the community level, the discrimination against people with disabilities, lack of information skills to assist people with disabilities to access digitized information. And we create an effect, it will create an effect language barrier. Some important information about disaster or pandemic such as COVID-19, including where to evacuate, importance of the vaccines, how to get the vaccine, are not very understood, especially by those people with disabilities that are still living in remote areas. And the impact, people with disability are more exposed to and vulnerable from disaster. And also people with disability cannot escape and be evacuated when disasters occur. For pandemic impact, people with disability become more vulnerable toward pandemics and are at greater risk of being infected. At the government level, some of the causes, such as a lack of skills and knowledge to develop disaster or pandemic content that is adapted to the need of people with disabilities, limited contents and tools or platforms for disaster or pandemic that are adapted to the people with disability needs, and also lack of access to digitized information. This causes an effect, a lack of access, and hoax threats. So some solutions are raised, including important information should be available in native languages to be understood and to avoid misunderstanding. This information also should be made available in digitized formats to increase its access and to counter hoax information. The expected outcome could be the dissemination of truthful information, easy to understand and easy to access, that will increase the knowledge, capacity, and resilience of people with disabilities towards disaster and COVID-19 threats. Next slide. For example, one of the famous folklore in Indonesia is the wayang kulit performance, which can serve as a bridge to disseminate information about disasters to native people. This is the picture of the wayang kulit at which the perception of beliefs, values, and attitudes held by the local community and indigenous people towards are influenced by wayang kulit and considered as a picture of people's life. These are some rationale, including the elderly and local storytellers may have a cultural bonds to the indigenous people. So this can simplify the delivery of disaster communication materials to them, especially to those who have physical impairments. In Java, a famous folklore in the form of leather puppetry known as wayang kulit has contained numerous stories about disasters and how to manage them. The implication: this approach can engage and increase local community understanding of disaster prevention among native people. Collaboration with native communicators or storytellers who have knowledge to the local community. And the message conveyed is made clear, concise, interesting, and convincing, and can be made adaptation to local contents and contexts. Also, it is using inclusive communication that can be understood by everybody, while also focusing on the understanding, joy, and action elements. Also, previously, during the pandemic 1918, the Dutch also using the wayang to disseminate about the pandemic flu previously in the past. Okay, next slide. So wayang kulit also is a promising disaster communication tool for native people, and it also promotes the adaptation and localization of disaster contents. BNPB already used this approach since 2014, which aiming to increase the resilience of native people and indigenous toward disaster threats. Another example, wayang kulit performance and localized contents to mainstream disaster issues across Indonesia also already done during 2014 until 2020 in different places, including Bengkulu, Pacitan, Blora, Malang, Pekalongan, and Yogyakarta. So wayang kulit promotes the adaptation and localization of disaster content to engage more audiences and increase the audience's ownership while mainstreaming and localizing communication on disaster issues. So reach more indigenous people, including people with disabilities that communicate in their native language. Next slide. The success of integrating the language into digitized disaster communication, targeting people with disability, requires creation of a national framework incorporating priorities, recommendations, targets, and stakeholders that should bear the responsibility to enable the process. So there are 5 priorities for a national framework to guide and strengthen the coordination and collaboration among stakeholders. The first one, the first priorities are the paradigm shift. So, and the second one, contents and apps, empowerment and capacity building, funding, and also the regulations. So 9 recommendations are developed. So first, shift local culture and paradigm, mainstream local folklore and localized technical terms, and standardized digitization communication materials and contents. And also develop specific hazard and COVID-19 communication materials. So, and also to empower people to access the information. Another recommendation is to improve local community capacity building and engagement, provide two-way communications and disaster simulation activities, while also secure the funding and financial supports and also secure the regulations. Next slide. So these are 9 recommendations we are trying to provide into more details on integrating native language into the communication for people with disability in Indonesia. For the first recommendation, to shift local culture and paradigm. So the example are expand access and resources for disaster-related digitized communications related to the culture and paradigm in communities and addressing the need of people with disabilities. Educate local community on culture and paradigm shift, establish collaboration among academics, learn an active role in mainstreaming the people with disabilities issue, while also explore the use of village fund or dana desa as a funding that is provided by the government to support the development in the local community. This is to support the implementation of the activities. The second recommendation regarding mainstream local folklore and localized technical terms. By localizing, translating, and integrating academic and technical terms for disasters and pandemics into local context and native language. And then repackage current cultural performances into digitized materials that can be accessed online easily, especially by people with disabilities, given current pandemic conditions. The third recommendation is to standardize digitization communication materials by developing mechanism and monitoring system to standardize information circulated among people with disabilities, and to ensure the standardization to guarantee the quality and form of information, the process of information development, and the veracity of the information. The next slide. The fourth recommendation is to develop specific hazard and COVID-19 communication materials. While the categorizing hazard communication materials specifically based on geographical regions, considering different hazard in the regions, and also to consider anthropogenic hazard in developing the communication materials, as one region could be seen without any hazards and considered safer to people with disabilities, but has other latent hazards such as forest fires. And also to develop common hazard communication materials, such as the pandemic and COVID-19 threats as a common material for each region in Indonesia. The fifth recommendation is to empower to access the information by providing training to empower isolated people with disabilities to gain the necessary skills to access the digitized information. Empower the people with disability with skills that can distinguish between truthful and hoax information. This is important considering people with disability is also vulnerable to the influence of hoax information. Number 6 recommendation is to improve local community capacity building and engagement by increasing the knowledge and capacity of family and community members to deliver information and also to facilitate the people with disabilities to gain access to the information. Involve the local disaster officials since they have first-hand experience in dealing with and rescuing people with disabilities in the fields. Next slide. Number 7, recommendation to provide two-way communication and disaster simulation activity. The classroom should be able to deliver the materials in two-way communications instead of one-way teaching activities. Disaster materials by engaging people with disabilities should be delivered and accompanied by simulation activity. Number 8, a recommendation is to secure the funding and financial supports. Engage a broad range of stakeholders for collective financing in integrating native language into digitized disaster communications, including the development of communication technology for people with disabilities, and to explore partnership with the private sector, including telecommunication companies that can support the development of communication apps for people with disabilities through their corporate social responsibility projects. Number 9, recommendation to secure the regulations. We can revise and update the contents of the current law, ensure with regulatory and legal framework, including to support the implementation of the Convention on Disability and National Law on Disability, which has already been ratified by Indonesia. Ensure the enactment of national regulation as law and laws are translated into regional laws or PERDA and implemented at community level. Next slide. So to translate recommendation into action, we try to develop a video through the digital platforms of the Disaster Risk Reduction Center Universitas Indonesia. The contents were already equipped with sign language to accommodate people with disability with hearing impairment and audio for visual impairment. Recently, the contents have been articulated to the local context by providing it with different native language options, such as Javanese, Sundanese, Malay, and also English language. So we can see the video by clicking this to the YouTube channel of the RRC UI. Please, the host or the co-host can help us to show the example of this video. Thank you.
Paranjeun perempuan hampir sadaya wilayah Indonesia rentan kana lini. Ulah panik, urang tiasa mirangan risikona. Lini tiasa kajantenan iraha wae sareng di mana wae. Hayu urang waspada tur sayaga. Linina teu tiasa dipahing. Risiko cedera sareng tilar dunia tiasa urang kirangan. Ieu tips kasalamatan dina mangsa lini. Upami karasa lini, ulah lumpat tur ulah pahibut. Gera drop atanapi sideku. Ia tiasa ngabantos awak kangkung saimbang tur susah bebis. Teras cover atanapi nang tayungan mastaka. Upami caket kanu meja atanapi barang sanes ngorondang lebet ka handapeuna. Mengarah ke halangan tina barang anu ragrag. Teras hold on, antosan dugi kali nina rengse. Upami aya di handapeun meja, cepengan suku mejana. Ngarah henteu gampil ngageser. Emut naon wae anu kedah dipidamel dina mangsa lini. Drop, cover, hold on. Hayu orang praktekeun pesen ieu bareng kulawargi. Urang sadaya siaga, sadaya selamat.
All right, Simon, I think that's all our presentation. Thank you very much for your attention, everyone. Thank you.
Thank you indeed, Dr. Fatma. That was a really presentation you shared with us, very thought-provoking for me. I think you've done a lot of the early work for us in helping, I guess, identify the lessons which we wish to take forward. So I have some remarks, but I might wait. Other speaker, Mr. Fatma Tamran, has spoken before I kind of just share a couple of reflections on your presentation, Dr. Fatma. But now I might first introduce Mr. Faisal Tamran, who is the Humanitarian Data Advisor at Ewing Global Pulse, Jakarta. He has more than 15 years experience working on humanitarian and development information management, mostly focused on identifying and harnessing humanitarian data to improve response. One of his flagship platforms is called Mind, M-I-N-D, a big data analytics and visualization tool that provides timely insights for natural disaster monitoring, emergency response management, earthquakes, cyclones and floods worldwide. The UN Global Pulse Network, he worked for the United Nations Office of Information Management Officer for years. He has responded to several major sudden onset emergencies, such as the 2006 Java earthquake, the 2009 earthquake, the 2010 floods.
Would it be possible to show my presentations on the slide and my slide, please, on the screen? Okay, thank you so much. Let me start. So as mentioned by Simon, so we'll be discussing about the information systems in development, humanitarian and disaster context. So we'll show some of the cases and example we have from our works within the UN Global Plus. Can we go next, please? So before I start, I would like to introduce a bit about what is the Pulse Lab. So Pulse Lab Jakarta is a joint data innovation facilities of the United Nations through the Global Pulse and the government of Indonesia via the Ministry of National Development Planning, which is Bappenas. So the functions of the Pulse Lab is basically as analytic partners, accelerators. So we apply a mixed methods approach in the problem solution and identity spaces, and is focused on catalyzing connections across the private sectors, government, civil society to support policies, actions, and for effective development of humanitarian practice. So we've done a lot of different projects to support not only government, private sectors, and other kind of organizations. Can we go next, please? So within the lab, we have three type of what we call teams, which is one is what we call data and policy teams. The other one is partnership and advocacy teams, and the other one is social system teams. So PLJ, the Pulse Lab Jakarta, has years of experimental kind of knowledge working with the development partners to design and implement information systems. So we create what we call the impact creation logics, where we are looking like illustrate like what you see now. It's illustrate how our mixed methods approach when we do projects, where each team's expertise contribute to the overall development of the systems, including problem assessment, solution prototyping, or building partnership with key stakeholders. So each of these our kind of teams is working differently, but at the end we try to join together to make sure that it's synchronized to solve to the problems that we have. Can we go next, please? So when the COVID started, I think we receive different requests, different discussions, different approach from different agencies, different organizations, to saying that how we work together, how we can develop a system, how we can do dashboard, those kind of stuff. So we try to step back. So we have like a small teams within the labs that try to step back and try to look into the baseline data within the COVID-19. So what we have done is basically we try to have a better understanding on how local governments report and update their COVID-19 data. So to be able to do that, we built like a 34 engines. So those engines is built based to customize, ideally to be able to extract data from the province's website. So we built the 34 engines to examine the 34 governments reporting sites and try to measuring, for example, what kind of tools they use, what kind of technology they use, and what kind of the data that they provide within the system, then how easy we can extract those data, or how easy we can analyze and interoperability between this kind of data set and data. So what you see within those with the slide is basically a visualization that we've done. As you can see, the blue dark one, it's basically how successfully we are on extracting the data. The red one is so that we have failed to extract the data because of certain aspects. So as you can see, the result is basically saying within the May 2020, when we are done the project, you can see that from the 34 provinces in Indonesia, it's only 20 that have reporting that can easily extract and how we could use the data. There's also there's a different kind of tools and technologies being used so far that make it quite difficult for us to be able to access the data. So, for example, there are some websites even on weekly basis change the way how they share the data, the design even. There are also some provinces using some sort of like a technology which is make it difficult for us to extract some of the information within those kind of platforms. Can we go next, please? So the whole kind of experience that we have within this baseline projects make us realize that there is few challenge, that there's a challenge and key issues that existing within the information management system. Is not only related to the COVID, but it's also related to disaster management, which is mostly related to poor interoperability between the existing data systems, the misalignment of incentive that inhabiting the collaboration of data sharings. I think we're seeing a lot this kind of things happens in different projects that we have. Poor data government engagement and disparities of the working modalities. So the paper that we create is basically based on this kind of 4 kind of issues that we try to explain based on our experience within projects that we've done, and then how much we are trying to address those issues with the different kind of mixed methodology that we've done within the lab. Can we go next, please? So what you see in this slide is basically the points that come from the different projects that we've done, that we presented also within the paper, which is focusing on looking into why it occurs, what is the root of the problem, as what is dominant factors from solving the problem. So for example, in this data interoperability kind of issues, I think we see these issues within our baseline projects that we presented before, where some provinces did not have a clear data structures, where those constraints in their ability to easily share the data or even used by other agencies or other organizations. This could be addressed. I mean, if there is a standard operation procedures related to how processing the data, transmit the data, or how to integrate it, data within the nationwide network that we have so far. So I think the investment in the resources required to build this kind of to maintain the system is very important. This is one of the problems analysis that we could see related to interoperability part. Can we go next? When we are looking into the incentive one, I think the biggest challenge in sharing data rests in the relationship and trust between parties involved and their level of participation in the process. I think incentive, be financial or non-financials, are essential to systemize the data sharing. I think it's important to recognize that. I think if you're talking about in practice, data sharings occur via different kind of means and methods. So, for example, we identify there are some kind of usually transactional kind of incentive by involving payment for the data. This happens in different methods in different way, either by the government or private sectors. There is mandatory kind of incentive where governments can mandate to data sharing in some regulated industries. This could be happens. I mean, it's also about the security, could also be one of the things related to these things. So also, there's a value partnerships, which is one of the things that our lab is trying to promote, which is and develop in some instance. For example, adaptations, particularly in private sector partnerships, where we gear toward the public good. So we have one of the examples. Basically, we work together with one of the mobile providers in Pacific, which is called Digital, on how we could do public good in terms of using share value partnerships, where the mobile data provider provide us with some data that we could use to support the disaster management kind of activities and response. Can we go next, please? Okay. On the data governance part, I think what we see so far, it's the data governance require commitment from the highest level to the lowest level. This is necessary to the various aspect within the decision-making process. So often when we talk about the data governance in the context of cooperation between different institutions, effective top to bottom data governance does not get fully implemented, because if institution internally data governance protocols does not make into account. So usually when it happens sometimes in the certain level, technical or even the senior level, without any considerations what really already there. So at least this is become one of the issues that needs to be tackled within the data governance. I think this issue, the data governance, also emerged in one of our disaster management projects, where the overarching data governance that was used within the project was based on interdirectory kind of a data governance model, which was primarily set up for generic data sharing. While we're talking about disaster management, there's a huge complex kind of the system needs to be involved in place. So, for example, sometimes different emergencies, when we talk about disaster level, even there's national type of the provincial disasters, national disaster, it needs a different kind of setup of that.
Hi, Pak Faisal. I think you're back. We did lose you for about 30 seconds or so, but I can hear you now.
Okay. Can you hear me very clear now? I think it's better for me to stop my video to make sure that I have enough bandwidth for the rest of the presentations.
No problem, Pak. Up to you.
You can still hear me now? Yes? Okay, can we go next on my slides, please? Okay, thank you. So on the working modalities, what we're seeing on the baselining projects, they indicates that there are different working modalities in each of the systems. So, for example, we observe that from the reporting lines and formattings that we've seen from the projects that we have on the baselining one, several provinces share the data on public sites through a common domain naming. The other one is basically using the regional health offices. So while there is a provinces with really good detailed data, this is far from being consistent across all provinces. Notably, there's a data being not really publicly available for review. There's a data also ranging coming from a PDF format into an image one. There are also inconsistent in the format which data is presented. So these disparities of working modalities complicate the building of a nationwide systems, especially in the view of the fact that significant resources have already been invested in work that is not easily data interoperable. So I think that is also one of the cases that we found when we're talking about working modalities. Can we go next, please? So this is why we think it's really important to consider this kind of addressing the issues of development of information system, because it could be improve the quality of information systems that we design. It also promote the better interactions between the systems and the relevant users of stakeholders. It optimizes planning and implementation in integrated information systems, and to develop nuanced understanding that underlying issues to co-create the solution. So I mean, if we are doing this properly, we could address these issues and then promote and improve the way how we do the information systems. Can we go next? So what is the recommendations that we would like to provide for this one? So the first recommendations is to apply service design principles to ensure better adaptations. So service designs, it's basically take it through a look of the end-to-end process and resources involved in developing information systems. It helps defining and understanding the problems and developing alternative solutions, choosing the best solutions and implementing the solutions. One of my colleagues within the lab, it's basically drew this, illustrate things that you see in the slides, which is basically saying how easy to understand the service design is basically looking into this kind of illustrations. So it's basically looking into the front end, the back end, and then looking into behind the skins. So what you're seeing here is the front end is where the users mostly interact within the services and what user use and see. This is what we call the front end of the service design. And then the back state is where the support needed to run the services exist, which usually include staff, hardware, sometimes can be seen by the user, but is visible to the user in most instances. On the other hand, the behind the scenes, it include the rules, regulations, policies, and budgets needed to support the front state and back state of the services. So this is one of our recommendations, is try as much as possible to apply service design principles to ensure better adaptations. Can we go next, please? The second recommendation is basically the established shared value data partnership for improved coordination. So collaboration frameworks with the data owner move from data philanthropy to share value partnerships. Data owners will allocate the resources to help us in understanding the data and validating our interpretations. This is something that we start to see more and more coming from the private sectors. Our works with the government counterpart is arranged directly or by our main government counterpart, the Ministry of Bappenas. So, for example, our data relationship with the statistic of Indonesia is via Bappenas, while the central bank is arranged directly. So we've done a different kind of modality, and then we'll look into what is the possibility, what is the best solutions to do, those kind of stuff. On privacy issues, I think we do not attempt to knowingly or purposefully re-identify or de-identify the data. So make all reasonable efforts to prevent any unlawful and injustice identification by establishing a proper non-disclosure agreement and data transfer agreement in place. So we have like a guidance note on data privacy, ethics, and protection. This is something that's also really important to make sure. So when we start a partnership with the different stakeholders, you have those kind of things in places. So you protect not only you, but also your partners through the process. We have some sort also, our analysis of mobile network data is under a project complies with the GCMA, the GSM Association privacy guidelines on the use of mobile phone data. So there's a lot of kind of works that we've done. It's basically as much as possible to make sure that the share value data partnership that we build to improve the coordination is covering in the whole aspects to make sure that the whole kind of relationship stakeholder that involved within all the process is seeing the benefit, have the motive and opportunity to be part of this kind of the project. I think that is one of the important aspects that we always thought through when we developed this kind of information systems. I think that's it from my end. I think next slide would be, yeah, true. Thank you so much for the opportunity. I'm looking forward for the discussions. Thank you, Pak Simon.
Terima kasih banyak, Pak Faisal. Again, another fantastic and very thought-provoking presentation there, Pak. I'm just having a look. So I have a few questions that have been asked already, but I might use, I guess, my prerogative as the moderator for this session to just offer a couple of observations or comments on the two presentations that we've seen and heard this morning. And embedded in that, there may well be a question. But firstly, to Dr. Fatima, great presentation. Thank you so much. I think, you know, it really highlighted, I mean, we've known for a long time, I think, that people living with disabilities are disproportionately impacted by disasters. It's very much in line with common sense, but for some reason, when it comes to disaster risk communication and disaster risk reduction efforts, we have, in many cases, still failed to put people with disabilities at the center of those efforts. So clearly, you know, if we want to minimize the loss of life, minimize the human suffering, we really need to do a better job. And when I say we, I mean globally, of ensuring that our disaster risk communication is really targeted to the needs of people with disabilities. And a point I think that came out very clearly in your presentation. There was a couple of other kind of quite interesting things that kind of came to mind. You know, of course, in Indonesia, many different languages, and in fact, not even everybody speaks Bahasa Indonesia. Yeah. But I hadn't actually kind of thought about, you know, the terminology that we use up until listening to your presentation. And in fact, I was sort of prompted to reflect that the word tsunami, which of course we use in English, is in fact a Japanese word. And in fact, also the word liquefaction is a word which, when I used that, when I was explaining, for example, to my family what occurred in Central Sulawesi in 2018, they couldn't understand that because it's the word liquefaction is a very technical term, kind of relates to a geophysical phenomena that they have no experience of. So I think, you know, that in a way was my way of coming at this using traditional knowledge, traditional folklore, such as shadow puppet performance or wayang kulit, to help really embed those messages in the community and not solely to rely on digitization. So sure, certainly digitization and messages through hand phones and other digital media, which get disaster messages out there is important, but we should not rely exclusively on that. We also need to rely on some more traditional modes. And in fact, my understanding of the Central Sulawesi earthquake in 2018 is that the mobile phone towers went down very quickly. They collapsed, and actually that inhibited the ability to get messages out there. So that was a really thought-provoking presentation for me. And you've done a lot of work for us as a group in helping distill out these sort of recommendations and lessons that we may want to take forward further this afternoon. To Pak Faisal, I had a particular question, and this is particularly in relation to where we're using, if you like, big data or data that was initially kind of captured for some other purpose, but we're using that data to target maybe early warning systems or other disaster risk reduction type initiatives. And this idea around needing to be kind of clearly aligned with the needs of the user when we gather data, when we build systems, when we design systems to distribute that data. And I see there may be a bit of a challenge there, in that often, in fact, there are many users of the data, particularly when it's public data. And it can be quite difficult to, I guess, fully anticipate what all those users' needs are, and therefore, how we can best build a system from the ground up, which caters to the needs of many users, and particularly where those needs are quite likely quite disparate, right? So we have different groups of users that have different needs. So how do we build, a single system or an ecosystem, in fact, which kind of caters to the needs of different groups? So that was, really something that kind of came to mind for me when listening to your presentation, Pak Faisal. So I'm just going to pause there in case Dr. Ibu Fatima or Pak Faisal wanted to say anything, and then I will turn to questions. So please keep the questions coming. I'm going to have a look at them right now. Over.
All right. Simon, can I answer the question?
Ibu, silakan.
Yeah. So for the question from Denika Blacklock, that the role of local DRL forums in localizing disaster risk communication, particularly for people with disabilities, but not only the local, but also the wider community, is to, I think, to have a collaboration or partnership and to increase socialization and community development in the local level. So we can also create a partnership with related and authoritative institutions to provide relevant human resources and facilities, and to ensure increasing the quality of risk communication to the community, especially to people with disabilities. So for example, by including the content and also the infrastructures, as well as risk communication for people with disabilities, by partnership with local government, local private sectors, and also local community, engage them and also educate them. And as we know that local community, while they are more knowledgeable about their local problems. For example, let's say, for example, for vaccination, some of local people will more or tend to be following their local leaders. For example, in Aceh, in Madura, and also in Kudus for vaccination. So they will more following their Muslim leaders or their local leaders to conduct the vaccinations. So by understanding the local needs and expectations, so disaster risk communication would be very much well understood and also well delivered. All right. I think the second question, can I also answer the second question? Yep. And
so Ibu Fatima, there's a question about, I guess, the role of the private sector in disaster risk communication. I think in your presentation, you specifically kind of referenced corporate social responsibility.
yes.
Now, but of course, there may well be opportunities beyond just CSR, just corporate social responsibility, opportunities to more mainstream disaster risk communication into the work of the private sector. So interested in any thoughts you have on the role of the private sector in ensuring appropriate disaster risk communication for people with disabilities. Thank you.
Yeah, thank you. I think we can develop a cooperation or partnership with private sectors, particularly through the CSR or corporate social responsibilities, or also in universities, we call it community services. So by engaging different stakeholders, let's say, for example, from the university, we can use community services funding. Usually each universities or from DICTI or from government, Ministry of Education and Research, sometimes there is a funding for community services. By using those funding and also in partnership with private sectors through the community social responsibilities, we can include all the stakeholders to prioritize this risk communication and education for people with disabilities, and also to include local knowledge. Hopefully this answers the question.
Yeah, indeed it has. Thank you, Dr. Fatima. So what I might do now is there's one or two questions there that are, I think, more directed at Pak Faisal. So I might just read the first one of those out. So in terms of data in information systems, it seems that the top-down approach in terms of regulation on integrated data and information system, while for the key messages for communicating the data, the information should be a bottom-up approach. So the question is that learning from COVID-19, identifying the target audience for risk communication was essential, while on the other hand, constant change of data and information also occurred. Learning from Bali in 2020, the target was to use the risk communication targeted seemed to be overlooked, while in 2021, the target audience was more specific, that are expecting women and elderlies. Any thoughts on how to appropriately find the key messages with constant change on data and information? So I put that to either speaker. I must say I'm not entirely clear on the question, but I more than welcome comment from either Pak Faisal or Ibu Fatima.
If I may go first, Professor Fatma. Thank you. I also would like to thank you, Simon, for your comment before related to the big data and how so many users involved within the process. So I think this is one of the key kind of issues that we highlight within our paper. So the applying of service design methods, for example, when we do system mapping, is help our teams to glean insights about what is the relevant stakeholders involved, what is the existing workflow within the organizations that would like to do or develop the information system, as well as the organization dynamics in which data analytic dashboard will be embedded. We do also sometimes using the conducting user research at this stage to try to help uncovering the actual needs and challenges of the dashboard users. So I think by doing those apply service design, we'll be able to try to identify what is the main stakeholder involvement, what is the needs of the partnerships, where is the solution space, where is the solutions, the problem space, or how we identify the problems, and then how we could try to solve this kind of problem. So I think that is why it's important. I mean, we learn from different experience. So for example, a couple years ago, we built a really, really good information systems using social media data. But one thing that we forgot is basically there's a lot of changes with this technology. So when we developed HazeGazer a couple of years ago, we took Instagram data to be able to identify where the haze using Instagram's image. And then the Instagram stopped sharing the data. So we have issues on this kind of stuff. So the partnerships needs to be there to recognize that there will be a challenge in the future if you're not integrate those kind of models approach to consider to looking into more deep kind of issues related to data structures, the infrastructures of the data management, how you can try to make sure that the data and information that it needs to be fit within your system, it will always be there. It will become in the right formats. It needs to become in the consistent way to be able for your system to don't have hiccups within the process or in the features. I think that's one of the important issues. I mean, when we're talking about the top to the bottom one, I think it mostly related on the way we seeing through our experience working with different stakeholders, that sometimes all this process on developing information system involve only the technical levels, while through the process, sometimes the decision making or the user is coming from different types of directorate or different type of user. For example, there's the user that it will be used the system all the time. There's the user that is only used the system to gain insights to be able to make decisions. There will be a user that only use that for certain kind of aspects. So it's quite important to make sure the top-bottom approach is there. So at the end of the process, everyone needs to have their own experience, their own kind of saying what they need, what is there, and then to be able to responsible to hold the responsible for any changes in the future. I think that's something that I can say for the time being. Thank you.
Thanks so much, Pak. So I have another question here, which I will share with both Ibu Fatima and Pak Faisal. It's quite a specific question. Bedridden and wheelchair-bound people with comorbidities, inmates in long-term care homes. I think they may actually mean people in elderly care homes. Hospices, old age homes, palliative care patients all face a high risk from the pandemic. So do the platforms discuss, permit crowdsourced data sharing of people at high risk at the local levels? So Pak Faisal, I think that's perhaps more a question for you. And I might actually just kind of add to that a little bit. I'm interested, I guess, in the intersection between our two speakers' presentations, if you like. We know often in the monitoring and evaluation community that one of the issues is that the data is not disaggregated, so it may not be gender disaggregated, it may not be age disaggregated, it may not be disability disaggregated. Again, we have this kind of issue around the need for those sorts of considerations to be built into data sets. But we're also talking about very large data sets, and again, drawing on big data to help us kind of take forward disaster risk communication. So I'd be interested from thoughts, I guess, on either of you around the level of specificity, or if you like, the identification of the individual and characteristics that relate to the individual in our disaster risk communication, but also in the use and management of data. So either Ibu Fatima or Pak Faisal hopefully has a comment on that. Thank you.
Yeah, Simon, allow me to answer this question. Yeah, and I think we need to have a different kind of variety of risk communication for different platform. Let's say to accommodate gender, age, and also disabilities. So, and also to have a, like what we did, we have a different language, local native language, to accommodate different local communication. And also maybe to provide or to develop and educate a cadre, basically from the neighborhood association or rukun warga, or in collaboration with primary healthcare. Let's say, for example, for COVID-19 awareness, we can engage more cadres from the airway or neighborhood association in collaboration with puskesmas or primary healthcare. By engaging the cadre, we can create or develop a variety of risk communication along with the expectation and needs of different groups. Yeah, I think that's from my perspective. Thank you.
Thanks so much, Ibu Fatima. Faisal, did you have any comments you wanted to make about
Yes.
about data disaggregation, essentially?
Yeah, I mean, that's a tough question. So I think there's a strong ethical and practical reason for the data disaggregation. We agree on I think we should agree on that. But it's coming back, I think, to the clarity in place of the policies. I mean, and that's important. I mean, when we're talking about data disaggregation, I mean, it's also related on the how sometimes, I mean, in the paper we mentioned about data literacy. So sometimes it's basically the way how people share the data or processing their data. If they don't really have enough experience, enough technical capabilities, they will have limitations in terms of those kind of process. Especially when we're talking about big data, you can do really good aggregate data sets to be able to an ethical and in terms of practical privacy kind of aspect, you should be able to address those kind of issues. But it needs more also related to how policies, how kind of SOP guidelines in place to make sure that people feel comfortable when they do these kind of things. But I think that will be one of the key things I think that we should try to address also within this kind of data disaggregation. Thank you.
Thank you, Pak Faisal. So I am just scanning the chat here. I think all the questions that have been asked so far have now already been answered. So I'm also just trying to have a look, and Danica might be able to help me with this or not, to see whether there are any raised hands. Certainly the questions don't all have to be put by me. You're more than welcome to unmute and ask questions of our panelists directly yourselves. So please don't be shy. I'm sure with the thought-provoking presentations from both our presenters this morning, I should say, that there are more questions out there.
If I may, Simon, I'll potentially kick off a couple of questions to our speakers, and this one is directed at Faisal. One of the key points of your presentation was around governance arrangements, and as you may be aware, one of the main objectives of the SIAGA program is to help improve issues around policy and regulatory coherence. What was, I guess for you, what was the biggest insight in terms of, the lack of policy and regulatory coherence in COVID-19? And what is the biggest lesson for the government in relation to data management around disaster management?
Thank you, Danica, for the question. That's a really good question. I mean, we can see there's a progress. I mean, it's a huge progress in terms of the COVID-19 data. I mean, what you're seeing from my presentations, I think when we've done the early days of baseline analysis, you can see that there's a huge kind of disparities on technological sides, data literacy side, and data management side within each of the provinces. We've seen that there's a provinces that haven't even decided what they would like to do. So every week we need to change our engines because they change the way how it looks, of the design of the website, the way how they would like to set the data, sometimes PDF, sometimes just image. So those kind of aspects is coming back and forth, and then it keeps changing through time. Nowadays, it's really good. I mean, I know now for sure that they're already centralized data set for this kind of things. So I think, I think one of the problems that we're seeing so far is it's basically that there's not really some sort of like SOP guidelines in place that quite clear in the early days to make sure that people already know what they would like to do, how they share the data, that kind of stuff. But I think one of the key aspects that we highlight within our paper is basically that sometimes the governance, the policy that was involved within the process of developing information systems is drawn from the internal kind of data governance or even policy that they have within their internal organization or ministers, which is sometimes is not applicable because we're talking about how to build relations between two different kind of systems. So the one that sometimes working internally is not always working when we're talking about two different kind of institutions. So I think to be able to recognize that and then try as much as possible to adapt by considering the internal aspects of your organizations and try to make sure the other organizations also have a different kind of aspect that needs to be considered, and then try to figure out what sort of the incentive, what sort of the modalities that needs to be in place, I think will be ideally could solve a lot of the issues that we have so far within the data sharing kind of the agreement and data management. I think that's what I see so far from my experience. Thank you.
Thanks so much, Pak Faisal. So I now might invite Vinod Menon. His hand, he has a question. So I'll pass the floor to you, Vinod. And in your question, can you please make it clear which of our presenters you are hoping to hear a response from? Thank you.
Yeah, I would like to, thank you, Simon. I would like to ask this question to Dr. Fatima. there have been serosurveillance studies conducted in many countries, and the results and outcomes actually show that the antibodies have been present in a large number of people. In India, actually, 80% of the people have been reported to have antibodies. So which means we also have a large number of people who may have got infected and recovered. So is that a similar situation in Indonesia too? And also the excess deaths which have been reported, we've had some studies which have been talking about excess deaths. I'd like to know about your situation there. Thank you.
Yeah. Simon, may I answer this question? Yeah?
If you can, Fatima, please do.
Yeah, it's a very difficult question actually. About the antibodies, that's quite possible. The situation, there are some people already infected, but then they develop the antibodies by themselves. Of course, yes, because once people get infected, they automatically create the antibodies for that COVID-19. And in Indonesia, we also have a plasma convalescence from the COVID-19 survivor for those who COVID-19 patients, because the plasma convalescence contains very rich antibodies which developed by persons who already get infected by COVID-19. And about the excess death, I think sometimes, yes, also difficulties to determine whether somebody is get infected before death or the death and caused by COVID-19. So during the first stage of COVID-19, pandemic COVID-19, there has been some dispute about this. However, then it has been resolved to determine the COVID-19 death, and including also the funeral for the patients with detected COVID-19. So it is along with our local government and also the central government has determined how we treat the dead bodies, and also how we treat like a Muslim has to be treated according to the Muslims funeral. So then it has been included in the guidelines by the local government and also the central government. I think that's all from my perspective, Simon. Thank you so much for the question.
Thank you very much.
Thanks, Fatima. Vinod, I might just add, having arrived in Jakarta in March 2020, essentially as the pandemic kind of unfolded here, there have been a number of studies around what they call seroprevalence studies to kind of map the level of antibodies present in the population. I'm not aware of studies which are national in scope. Obviously, that would be a big exercise in a country like this, an even bigger exercise indeed in Indonesia, in India. But certainly, there was a study which was released really just before the Delta outbreak really took hold here in Indonesia, which showed that more than 50% of those surveyed in Jakarta had already been exposed to the virus. So I think, you mentioned 80% 80% of Indians with antibodies. I'm not sure if there's a study in Indonesia that gives us an equivalent, but certainly for large urban centres such as Jakarta, it's reasonable to think or to assume that in fact there is already a very high level of prior exposure, either through exposure to the virus or indeed through vaccination. Hope that answers your question. Now, I know Pak Faisal's going to leave his camera off, which is a bit of a shame because he's a good-looking fellow, but he's having connection issues. So we might not be able to see his face, but he's still with us and still available available to answer any questions. So again, another appeal from me. Any questions, please raise your hand and I'll come to you. So if there aren't questions, the risk is, of course, that I just keep asking our presenters things that are of interest to me, which may in fact not be the things that our audience would like to hear. But so I've got another question, particularly for Pak Faisal, which is around privacy. And certainly in countries such as Australia, there is a lot of concern, a lot of discussion in the media about I guess, what data corporations are collecting on us, what data, in fact, our governments are collecting on us, and then who are they sharing that data with and for what purposes? And do we have a right, I guess, to agree that that data which relates to us is shared with other parties? So I didn't note much mention of that kind of issue around data privacy in your discussion, Pak Faisal. I think I assume we'd all agree that actually sharing to help minimize the impact and losses of disasters is indeed a good thing, but perhaps needs to be balanced against individual concerns about data privacy. Did you have any comments you'd like to share with us on that, Faisal?
Yes, thank you, Simon. I mean, yeah. So we do, as a UN Global Pulse, have a data privacy ethics and protection principles. I mean, even now within the broader humanitarian kind of aspects, there's a data protection guidelines just coming out from the OCHA, basically highlight those kind of how important of those kind of issues. And I think one of the highlights, I think, when we're talking about data privacy, especially within the disaster management aspects, it's moving quite fast now. So I think agencies should try to adapt with the situation. I mean, I think recently I hear there's a lot of discussions about to establish what they call the ISP within the Indonesian context, which stands for the Information Sharing Protocols, which is ideally it's some things that people. So what happens is basically there's a lot of kind of discussions within the colleagues within the humanitarian community in Indonesia on how important the information sharing protocols, because nowadays everyone collect information, everyone collect data during the disaster management, but there's no one really put it into accountability when you collect the data. So it's important to make sure that you protect the people that you collect the data, you protect the information that you share. And then the only way to be able to do that is basically start within your own kind of organizations. I mean, to looking into, I mean, for the Global Pulse, we have those kind of privacy, ethics, protection principles in place. We have all the guidelines on how to do things, especially with the different data sets that we're playing around. So, for example, on mobile data, we follow the guidelines that coming from GCMA in terms of we compile the GCMA association in terms of using mobile data, those kind of aspects. So I think it's a good starting point. I think people should try more and more looking into this kind of aspect. I think ICRC, IFRC have a really good kind of data protection guidelines in place for the humanitarian operations. So I think those kind of aspect needs to be put it in place into considerations when agencies or organizations start to collect data, because you never know what will be happen. So I mean, I think ISP's initiatives already been done now in Indonesia. I think it's a good starting point, because ideally what you're looking into is as much as possible putting a protocol in place to make sure that it's a starting point to start to consider on the data policy, data protection kind of issues. I think that's my takeaway. I mean, it's a new kind of aspects. I think people needs to be exposed more on this kind of subjects to be able to have more understanding on this kind of things. And then by doing that, I think it will be helping a lot in terms of have better understanding what it's needed to be able to do that. Thank you.
Thanks very much, Pak Faisal. So I can see that Lily Hesti has raised, I think it's her, apologies if I've got that wrong, has raised his or her hand. So can I please pass the screen to you, Lily?
Thank you, Mr. Simon. So actually I want to share and ask to both of the speakers. This is based on my experience. So I'm a medical doctor, which also recently come to many disaster areas. So in my experience, after the earthquake, the local people will there is some hoax news, so many fake news in the local area. So after the Mamuju earthquake in the last January, I come to them, and then there is some fake news that there's gonna be tsunami after the earthquake. So they come to the higher place, then that it makes us difficult to give the treatment to the healthcare. So I would like us to Professor Fatma, do you have any experience for this, and how do we cope to solve this problem, because it's quite make us difficult to come to the highest. I mean, the area is very difficult to reach. So how do we cope this to the problem? And next to Mr. Faisal. So when we come to the refugees tent, they were reject us because the fake news is we will go to screening or make the vaccination of COVID. And so they're afraid that we're gonna be make a swab or something. So Pak Faisal, can we locate or detect if there is some fake news, such as in social media like Twitter or something, that so we can cope to the problem, because it's quite make us difficult in the location of area. Thank you very much.
Yes, Simon, allow me to answer Ibu Lely questions, ya.
Silakan,
Right.
Fatma.
Ya, terima kasih, Simon. So for evacuation, I think we need to have a evacuation plan before the disaster strikes, and also prepare for the evacuation. And also during the disaster, including how to reach evacuation shelters, and also how to conduct the evacuation plan, and also to prepare all the warning signs or the evacuation signs and route which are determined before the disaster strikes. So during the disaster, people exactly knows what to do after the disaster strikes. For example, when we do the benchmarking to Japan, there were two different evacuation plan was there. The a vertical evacuation plan during the tsunami strikes, and there are no victims because of that. So because they have already have the evacuation plan for a earthquake and then followed by tsunami. So they move to the highest level of the schools, while the other schools doesn't have the evacuation plan for the vertical evacuation. and there were so many victims because of the miscommunicate of the evacuation plan. I think those we need to have ahead of evacuation plan, also determined for the evacuation shelters beforehand. Thank you, Simon.
Thank you, Prof. Fatma. So is it start from the mitigation plan or preparedness?
Yes, that's right.
But
And
what about if we just we cannot to do that? Then when we go or we arrive in the location and the local people reject us or come to the lower because they afraid there's gonna be tsunami after earthquake. Perhaps do you have any experience or something? Terima kasih, Prof.
Yeah, thank you. We need to understand who are the local people who has the great influence on the local community. So by using these local leaders or local influencer people, will understand and will follow your risk communication. So we need to identify and understand the local leaders and also to involve them while communicate the disaster risk.
Okay, thank you very much. But actually, we already do that. What they still reject to come down. So it makes us difficult to make the health service. And this is also for the refugees stand because there's so many fake news in the pandemic era. But anyway, thank you very much. Terima kasih, Prof. Fatma.
Thank you.
Thank you, Fatma, and thank you, Ibu, for the question. I can see Pak Faisal's back. Pak Faisal, did you have any comments you'd like to make on that question?
Yes, thank you for the question. I think, yeah. So let me try to talk on the technological side when we're talking about the hoax one. So there's some requests coming for the Pulse Lab Jakarta to do those kind of aspects related to the hoax one. But too many channels now. I mean, when we're talking to Twitter now, I mean, if you're seeing the trends of the Twitter recently, I mean, most of the hoax is not only coming from Twitter. I mean, I think one of the findings, if I remember correctly, done several years ago after the COVID and also for the Palu earthquake, it's also coming from the WhatsApp. Mostly it's from WhatsApp, basically, because we don't have so much access to it. So it's quite difficult. I mean, Instagram, Twitter, there's so many channels now. So it's very difficult to tackle those kind of aspects related to hoax. I remember a couple of years ago when we tried to do some analysis using news data. So what we've done is basically we connect to one of the news data providers. And then what we'd like to do is basically try to analyze the information related to the casualties. So we're looking into the casualties news coming from the news, coming from different media outlets to try to figure out what sort of the casualties numbers that is being reported through the media and how those numbers related to the official numbers coming from the government. So on those cases, we are looking into the, I think, Palu earthquake. So what we've seen is basically that on the early days, there's so many reporting on the casualties coming from different media. But every time the governments release the official statement of the data, the numbers going down follow the government numbers. After a while, it's getting up again. So the media is basically, it's been up and down, and then it's most of the downtime happens when the government release the new data. So it's quite important, I think, to make sure that the communication, the dissemination of information that coming from the official side, it's coming on the updated on regular basis to make sure that there's no kind of those kind of aspects needs to be happening. I think we also seen so far within our process when we've done a lot of technology analysis kind of data, it's basically that data that coming from, for example, Twitter sometimes it's basically also it's not only geotagging, so it is quite difficult to figure out is it all really coming from the ground or not. But I think IFRC, I think there's a different agency already done really good kind of initiative in terms of the try to figure out how to tackle this kind of works. I mean, I remember now during the Palu earthquake, they have some initiative where they collect data from the ground, try to identify what kind of hoax information that coming, which of the channel of the hoax coming in, and then try to tackle this hoax with the different methods. I think that would be ideally something I think we should try to look into it, try to connect more with the different partners to try to figure out. I mean, recently there's a RCCGE kind of working group focused on risk communications. That could be ideally partners that you can work together to see what kind of the things that's there. I think that's it on my side. Thank you.
Thanks again, Pak Faisal. And look, we've had one last question come in. We are almost out of time, and furthermore, I'm getting hungry. So for those people in Jakarta, it's lunchtime nearly, right? So Pak Faisal, it's a question I think for you. If you could just maybe take 60 seconds or so to answer it. The question comes from Vinod Menon, and the question is, did Indonesia and Australia use the data sets for any scenario analysis or modelling to identify clusters of high incidence and use IT-enabled containment strategies? And I think actually you could perhaps just talk a little bit about the approach taken in West Java, the West Java provincial government, and the work that POSLab Jakarta did there to sort of provide an analysis around, I guess, lockdown strategies and the like. So maybe if you could just give people a very quick kind of overview of that, and then I'll provide some closing remarks and we'll go off to lunch. Thanks, Pak Faisal, and thank you again for the question, Vinod.
Sorry, Simon, will it be possible I pass by these questions to my colleagues? I think Daisy is still around. She is the one that's responsible for this, the West Java project, and she will be explained even better than me on this aspect. If it's still around, if it's not, I can explain also. Daisy, are you still around?
If Daisy is here and able to jump in quickly, that'd be great. So just pausing a moment there.
She's not around. I mean, she also texted me before she having issues with those internet. So yes, so one of the things that we're trying to do with the West Java province is looking into the social restrictions kind of aspects where it could be applied based on the incidence on the COVID-19 data that we have in West Java. The best things about West Java is basically they have one of the best data management systems on the COVID-19. So they have those kind of really good databases that they put it in place. They also have invested a lot of the data infrastructures, resources of people to be able to do this kind of analysis. So what we've done is basically for the West Java data, it's basically we repurpose some of the census data to be able to do early analysis on what's really going on using the census data combined with incident data, COVID-19 data that coming from the West Java, and then using waste data, which is coming also from the West Java province, to be able to understand the mobility movement and how we could apply social restriction access within each of the, I think, subnational level within the West Java provinces. So it's a combination work not only from the data part, but it's also from the epidemiology kind of side where they provide domain experts to help us to doing the analysis. Most of the data analysis has been done together by us and the team of the West Java. And then as much as possible, also the involvement of, I think, different stakeholders. I remember the Australian government also involved in this process together with the Ministry of Health, and then the commitment from the central government also there. So I think it's an example on how much we do those kind of analysis. But I think the most important aspect within those processes is basically that it shows that while there is a lot of data set out there that could help, for example, we use ways to mobility, there's also Facebook data or even Google, but you also need the collaboration from the project owner or from the province itself, because the commitment needs to be there to be able to understand what they need, because we domain expert within data analytic parts, we don't really know exactly what they really need. So it's important also to highlight that the commitment, the involvement, the collaborations in place that coming from the national, even the subnational actors like Provincial of West Java is a huge contribution to the success of the project. Thank you. Hope that answered your questions.
Thank you. Thanks so much, Pak. So look, Pak Faisal, thank you to you. Dr. Fatima, of course, thanks to you also. I'm just going to provide some very kind of brief wrap-up points before we pause for lunch. So, you know, two really interesting kind of discussions there, some good questions. Sort of some of the key takeaways were around the role and the importance of local disaster risk reduction forums, you know, the private sector and the role that universities can play in supporting localization of the disaster risk communications. That this approach can particularly increase the quality of communications and the uptake by local communities and ensure that they're knowledgeable about the sorts of hazards and the sorts of challenges they face at the local area. One of the biggest challenges to risk communication is the needs to be accommodated on different platforms to accommodate for different groups, but to relying on data coming from different stakeholders. So we have a very rich array of data and information these days, and making the best use of that to get the risk information messages out there to all concerned remains a challenge. Data disaggregation relies on standard operating procedures, which in turn rely on clarity of policies. So it is essential for tailoring risk communication to different groups, those SOPs, having those SOPs in the first place. Data and communication is reliant on workflow, which is impacted by both internal and interinstitutional capabilities and relationships. And finally, combating misinformation and hoax requires a degree of disaster literacy amongst the people, amongst the population, as well as an understanding about where to turn for trusted information. And in fact, where to get regular and reliable government data to help increase, you know, confidence of understanding what the situation really is. So those were some of the takeaways for me. Indeed, different participants, I'm sure, would have got different things from today's discussion based on their interests and the areas that they're working in. Thank you once again to both our speakers, Terima kasih banyak. And thanks to all of you who asked questions, and indeed just all our participants for joining us for such an interesting session this morning. Thank you very much, and sampai nanti.
Thank you very much, Simon. Thank you very much, everyone.
Thank you, everyone. Thank you, Simon, for the facilitation.
hour and were able to watch at least part of the lessons learned video that was prepared by Siap Siaga on the sort of high-level lessons from COVID-19. My name is Danica Blacklock, and I work for the Siap Siaga program as the head of knowledge, performance, and learning. I was quietly listening in, taking notes this morning while Simon Ernst moderated our session, and I'll be your facilitator this afternoon. I'll be reporting our findings and discussions back to the final plenary session later today. While we largely sat and listened to the two presentations this morning, this session is really about getting your feedback. And so the next 90 minutes, it should really be considered a focus group discussion on the key conclusions from this morning's session. Cameron and Rimba and I will be working with you all to discuss those findings. And over the lunch break, we put together some of the ideas and questions for discussion in a PowerPoint presentation, which I'd like to quickly present to you. If I can have the PowerPoint on the screen, please. Thank you so much. So let me just run through the key conclusions from this morning's session. Next slide, please. All right, so first of all, based on the presentations this morning and the discussion and questions that were posed, the role of local disaster risk reduction forums, the private sector and universities in supporting the localization of disaster risk communications, particularly as it can increase the quality of communications, given that local communities are more knowledgeable about local problems, the local needs and local expectations, as well as the quantity of the communications that is delivered to the community. Secondly, one of the biggest challenges to risk communications is that it needs to be accommodated on different platforms and to accommodate the needs of different groups. However, this relies on data coming from a variety of different stakeholders. Third, data disaggregation relies on SOPs, standard operating procedures, which in turn rely on a clarity of policy, which is essential for tailoring risk communications to different groups. Fourth, data privacy remains a big issue. How do we ensure accountability for the data that organizations, whether governmental or non-governmental, collect and share? And what kind of policies and guidelines are needed, and how can they be enforced? Fifth, data and communications is reliant on workflow, which is impacted both by internal and interinstitutional capacities and relationships. And not just relationships, but also the coordination between those, between different institutions. And finally, when we're talking about combating hoaxes and misinformation, this requires first an increased disaster literacy amongst communities, as well as an understanding of where communities can turn to for trusted information, and B, regular and reliable government data updates to increase confidence in the government communications to the communities. So that said, let us discuss these 6 different points. And of course, any other points that we may have missed from this morning, which you feel are quite pertinent to the topic at hand. In the next hour, we have opportunity to really get deep into discussion on these issues with the aim that we can pull our thoughts together on some key recommendations and lessons to be presented back to the plenary session at the end of the day. Just as a quick reminder, we'll be engaging you through the raised hand function as well as the chat function in the Zoom. So please feel free to send any questions or comments in writing during the session. But also please make sure that your interventions are brief and aligned with the topic at hand, so that we are able to consolidate the inputs into, as I mentioned, some conclusions, lessons, and recommendations. So with that said, the floor is open, and may I ask us to go to the next slide, please, so that we can look at the questions. These questions are simply to allow, to prompt discussion on the issues. And if you have other questions or topics that you would like to discuss, please do let me know. So, is there any questions, any responses? Yes, Pak Noto, I see your hand raised.
Yes, thank you, Danica.
Yes, did you have a question?
Yeah, I think the first question is very interesting, and I would like to hear what the presenter this morning say about this, particularly Faisal, on the data management. Is there any example of good policies that will ensure the interoperability of data, or if it is a solution, the solution is technical, perhaps some examples of interface between the different data?
Thank you, Pat. Pak Faisal, did you have a response to that?
Yes, thank you, Danica, and thank you, Pak Noto, for the questions. I think if you're talking about one of the good example of policy, I think Satu Data Indonesia will be ideally. It's the example. I mean, the government currently doing a lot of consultations with the different ministers that hold this important data sets to make sure the interoperability happens within each ministers. I think that is a good example on how the policy it happens. But I guess this is also needs to be not only taking on the higher level, but it's also it could need to be the implementation within the technical level on how all those kind of the technology infrastructures in place within different kind of ministers will be able to communicate or interact, to be able to sharing data, to be able to do some sort of data processing directly, those kind of stuff. So I guess while it's a good example on the Satu Data policy, I think it also needs to be followed up within its aspects, for example, the technical one. Thank you.
Great, thank you so much. That's really helpful. And yes, I believe, yeah, the Satu Data Indonesia is very interesting, interesting example. I would ask you this. I mean, when we talk about Satu Data, my understanding is that it's very much a government program. One part of the question was really around sort of the multi-stakeholder aspect of data management, sort of the secondary data, if you will, that comes from NGOs or international organizations or even the private sector. How does that how does that fit into the government policy on Satu Data, or does it not? Is there no space for it?
Well, I think when we talk about Satu Data, I think we talk about the baseline data, which is the basis for the whole kind of interoperability or data sharing is in place. So for example, I give you a concrete example. So for example, let's talk about, let's say, administrative boundaries data sets that the government of Indonesia has. Those includes the names of province, sub-district, district, or even village, which is a basis or a baseline kind of data set. If this kind of data sets will be available and openly can be accessed by anyone, that will be facilitate the changing of information, because everyone using the same data set. So for example, if you're talking about the secondary data sets that produced by other agencies or other NGOs, I think if they use a proper or a very widely used baseline data, the interoperability changes between those systems, those organizations will be easily facilitated, because everyone using the same standard, everyone using the same baseline kind of data. So I think that's why Satu Data will provide a really good foundations to address a lot of issues related to the data management and data interoperability in Indonesia. That's my personal thoughts. Thank you.
It's interesting, Faisal. Actually, I have follow-up questions on that, if you may, Danica.
Absolutely, please go ahead.
Yes. Faisal, are you saying that technology is not always the answer? Or is it possible that if no matter how the data is designed, if we are good enough in designing the interface, we can overcome all of this problem?
That's a really good question, Panuto. So I'm a believer that technology, so we need to look technology as a collaborator kind of tools, not as a problem solution. I mean, I see sometimes that agencies, organizations, or even people that consider that technology will be the answer for everything, usually they will be failed to be able to achieve what they would like to do, because it needs to be run by the human technology, and sometimes there's changes within those technologies. So I do believe that the technology is important. It's enabling factors to do all these kind of things, but the human type of work, the behind of skins kind of work that I mentioned before during my presentations, to support those kind of technology, to support those kind of information sharing, to support that kind of policy is also important, I think.
Thank you. Interesting.
Extremely interesting, and thank you, Patnoto, for providing Faisal with some very easy questions to answer. And thank you also, Pat, for kicking off the questions. Is there anybody else in the group who has potentially experiences to share or lessons they've learned in their own work? I mean, across the region, and not necessarily in relation to, COVID-19, for example, but other disasters, whether they be national or at the local level.
Or maybe Dia, since Dia is here, maybe Dia want to share something on what you guys doing in Bali as a Bali One Island data.
Yeah, thanks, Odon. Actually, before I have to bring up my questions previously before the lunch break, Danica.
Yes, please go ahead.
Yeah, specifically about the communication risk strategy that Bali is actually now doing. So I'm going to get into the one data for Bali, or don't worry. So but anyway, I'm not sure if Ibu. Sorry, I cannot open my video. It's the connection here is a bit cloudy here in Bali. Thanks. What was my question? Yeah, about the key messages regarding to the constant change on data and information, because basically communication is based on the data and information available. I don't know if I'm allowed to go back to my previous question, Danica. But that's first one, and then the second one is about Bali One data. The challenge is more on the integration of the many data and information systems in Bali that highly dependable on the regulation from the national level. I think those two are from my side, Danica. Thank you.
Thank you, Dia. That's really helpful, actually. Yes, and I think your question from this morning actually resonates well with the topic here when we talk about data management and risk communications. It's quite multi-stakeholder. Well, it's increasingly becoming multi-stakeholder space, and the issue you raised this morning is very relevant. I mean, you have communications, you can put together communication strategies, whether they be government or from other stakeholders, but then the information changes, and then how does that impact on the strategy? So I think one lesson to take away is, when we're developing communication strategies, how do we develop those strategies in a way that they can be adapted to, first, rapidly changing technology, and second, rapidly changing contexts and information that's being received. COVID presented us with several examples of, the challenges that came to that. And so I put out to the floor, challenges that others have faced in their organizations. You have how the sort of rapidly changing context impacts on the communication strategies or risk communication strategies that you may have in your work. I see in the group a number of people who were working together with Siap Siaga on sort of government communication. So I would, please do share your experiences on how, the sort of changing contexts and what have you impacted on your day-to-day work. No.
Hello.
Yes, Pat Riza, please
Hi,
go ahead.
Danica. This is not to respond to your queries, but more on learning from the COVID-19 data management, where few line ministries involved in developing the similar data for the COVID response. In fact, it should not be that way, as knowing that it has to be a policy where one data for the COVID response that can be accessed by all of the ministry involved. This is maybe for discussion. We found that it's very difficult to get the complete or the full access to the data, not just access through login, but through application programming interface. It's almost impossible to access the API. While this data is very needed by the related line ministry for the policy decision and recommendation. So I don't know. In my mind, it has to be a very explicit policy and regulation on this, and where only one data, but can be accessed, fully accessed by the related line ministries. And the second one is more on the questions, back to the issue raised in the previous session on the data protection. I found that the draft of law of data protection is being it's not moving to anywhere. I know it's now is in a priority for Prolegnas, but it's not moving that progressively. This is indeed very, very important. As if I'm not mistaken, we are the only G20. Indonesia is the only G20 members who doesn't have the data protection law. So this should be prioritized. But maybe for Pak Faisal to respond how to push into that direction so this draft law can be enacted soon. Thank you.
Yeah, thank you, Pat. That's a really good point, actually, what you talk about. I mean, even, hopefully Pak Faisal can reply to this. I mean, even with the, the Satu Data Indonesia, like the policy and what have you, access is such an important, seems to be a bit of a gap. I know, for example, during the response to Cyclone Seroja, in NTT earlier this year, one of the problems was the fact, I mean, of course, data collection was a challenge, but in order for different stakeholders to access that data, they had to know the specific person in charge of the data. And it made, it became very much a game of who as opposed to sort of, a right to access data to make, to develop the sort of response to the disaster. So, Faisal, any thoughts on this? Of course, we don't expect you to have all the answers, but I'm sure you've given some of these issues some thought.
Yes, thank you, Danica. Yes, I think it's so I know I think Parisa mentioned really important aspect on the data protection and then say that we are the only G20 countries that is still not. But I hear it's the process is ongoing and going well. I mean, but I mentioned also early during the morning sessions where we talk about data protection. I said that from what I understand, the humanitarian actors in Indonesia is looking into, for example, start to looking into data protection in the different in more kind of practical way. So one of the aspects that they're looking now is basically to see will it be possible, for example, to start to have what they call the ISP, information sharing protocol. This is the first steps. I think that it's important because I think I hear a lot of people talking about data protections, but there are huge aspects within data protection itself. So I guess to start to get exposed into it, or even to start to doing more practical way, for example, the information sharing protocol, I think that's really a good first steps, because for the time being now, I think when we respond to emergencies, I think, like you said, Danica, during the Seroja one, there's a lot of information being collected by different partners, and then usually it depends on how much you know to contact which person that involved or what the right person that you can contact. You can easily get the data without realize that sometimes those data that's been shared, it's consists of information that it's have a privacy or can be identify location of other vulnerability groups and so on. So I think it's important to start with those kind of practical way, for example, like doing the information sharing protocols, or even start to read all these data protections that it's coming from different agencies to get the sense and understanding what it's really about and why it's important for us to be able to start to think about it without even waiting until we have the law itself. So I think that's what I thought it would be important.
My apologies, I was muted. I think you make a very good point about, we have, it's not even just about talking about data sharing and data access, but we need to, everyone needs to understand why data sharing, sharing is so important. start there and overcome some of the key bottlenecks. Sometimes we have to go back to the basics. Very good. I'd like to move on to the next question, actually. And Ibu Fatma, I'm sure you'll be on the spot here. You know, when we talk about sort of fake news and hoaxes, a lot of that, as we mentioned, is shared sort of in the community. You know, particularly coming through social media, and as Faisal mentioned earlier, just around sort of, you know, WhatsApp groups and what have you. So I wanted to put to the group, you know, what is in your work, what's been the biggest impact of the fake news and hoaxes in disaster management, and, you know, what kind of actions do you believe could be effective? I'm not saying that they would be or that they should be, but what, you know, what are some options out there that we could, you know, trial to combat this issue, but also around sort of fake news, but also simultaneously increase disaster literacy in communities, particularly amongst vulnerable groups like people with disabilities?
Okay, Denika?
Yes.
So from our previous studies on the COVID-19 pandemic control in Indonesia from 34 provinces, we found that for combating fake news and hoaxes in disaster management, I think we have to conduct the news monitoring. So by doing the media or hoax and news monitoring, we actually identify what the next problems could be arise. Let's say, for example, now probably we are facing the news and also the information regarding the Delta virus, the COVID-19 Delta variant, and also the possibility of having the third wave of COVID-19. So by doing the media monitoring and also the information monitoring, we are anticipating the probable fake news and hoaxes in COVID-19. So then by monitoring those new information and upcoming information, we could prepare different or various types of actions, including engaging media and also pentahelix collaboration to conduct hoax management and news management. So first monitoring and identify upcoming or future information and news, and then preparing the information to combat possible fake news and hoaxes in the future.
So basically, we're talking about communications mitigation rather than communications response. Okay, well, it fits nicely with the topic for the day. That's actually really helpful and insightful thing. I mean, as with everything related to disaster management, it's easier to mitigate against something than it is to respond. And that's a really useful insight. I mean, most of the sort of information or suggested strategies that I've seen really sort of revolve around, you know, how to combat hoaxes after they've emerged versus, you know, predicting the types of hoaxes that could come as the news cycle changes. So it's good. Any others who've had experiences working in combating hoaxes or working or conversely working on disaster literacy?
Yes, Denika, can I?
Yes, yes. Absolutely, please.
Yeah. My name is Andrew. I am a member of the team Prof. Fatma from the DRRCOE. So actually, regarding the hoax threat, to the people with disability, of course, they are more vulnerable than us, because they cannot get the information properly, so they are more prone to the hoax. So regarding the mitigation, we have talked with the resource person. So how to mitigate the hoax, what they are doing to mitigate the hoax, they are doing like an organize themselves. So surprisingly, they can coordinate themselves very nicely. So they are organized themselves, they are coordinated themselves inside the WhatsApp group. So right now, they already have 40 WhatsApp group for the poor people with disaster. To mitigate the traffic of the hoax information, those WhatsApp group are like what they call it, like a certified. So they have like a system right now. So there is like a coordination. So actually, this is come from the community organization, yeah, from the non-government organization. Some people that care about the people with disability. These people are not disabled, but they are caring the disabled people. So for mitigating, these people are this person are responsible for coordinating the WhatsApp group. So this person is like the watching what's going on the WhatsApp group, coordinating, and also make sure that one of the mitigation strategy is make sure that all the information are rechecked, check and recheck. So this person are function to mitigate the hoax by providing service of check and rechecks, and also make sure that the information are linked directly to the official source. So I think in the future, what we can make and what we can develop is how to make a system. Yeah, actually now we already have a system to mitigate the hoax disaster, like how to check the hoax information. Yeah, Indonesia already have that system, but how about the system that made specifically customized for the people with disability? Right now, they are helped by a person that doing that service, that certified the WhatsApp group, monitor the traffic like that. But in the future, I think we need that kind of application, Danica, to make sure that all the information are truthful. There is no hoax. I think that is what we can do to mitigate information among the people with disability. Okay, over to you, Danica.
That's really really interesting. So I mean, on the one hand, we see sort of social media, and particularly, I mean, in Indonesia, WhatsApp groups being sort of the source of the spread of hoaxes and misinformation. But conversely, we could also turn that around and turn WhatsApp groups into a way to increase disaster literacy by being able to link, ensure that information that's circulating is linked to official sources, as you say. That's really, I think insightful that we often view technology as, sometimes we don't always view it as the source of the solution when we're confronted so often with it being the source of the problem. So thank you very much. Anybody else with sort of experiences or ideas, strategies that you've worked with related to increasing disaster literacy and combating sort of the fake news issue? This is particularly important when we're talking about sort of vulnerable communities that don't always have access to the same types of information that others do. Yes, Vinod, please go ahead. You have your hand up.
Thank you, Danica.
I'm scrolling through I have to scroll through the thing to find hands up.
Yeah, thank you. I was thinking that actually, the use of celebrities to give messages on electronic media and print media on voice clips and video clips would be very helpful. And similarly on, community radio and also, FM radios on automobiles, on vehicles will also help, because a lot of people will be able to get access to that. Similarly, social media platforms like Twitter and Facebook and others could also help in disseminating this, in addressing fake news. Especially if government officials who are in charge of disaster management, the National Disaster Management Authority, and senior officials and disaster management practitioners can address them, then that will also restore confidence. Thank you.
Yeah, I think as you talk about celebrities, when you talk about celebrities, you mean like the bona fide celebrities, but also, I mean, we have, obviously the phenomenon of social media influencers and such. I guess on the flip side of that, of course, is you also have others who are sort of, the ones who help to sort of spread hoaxes based on personal beliefs and what have you. So,
no, I think if you could actually, verify the antecedents of such people. Celebrities are essentially people who have large mass following, people like film stars, people like, literary figures who have large mass following, especially among the youth. I think it will be very helpful if, these film stars and celebrities, writers, and thinkers, and as you said, influencers on LinkedIn or on Facebook, could actually help. Thank you.
Okay. Yeah. Thank you. That's the ones that sort of form the partnership with the government communications on particular issues. That's good. Cool. Thank you so much. All right. I know that the sort of fake news hoax issue can sometimes be a bit controversial, and we don't always want to engage, on sort of how the impacts have been, although there was a very helpful insights into sort of, what the impacts can be this morning, just, when just because of sort of the low level of understanding of the link between earthquakes and tsunamis and how to evacuate and what have you, and then people being concerned about, going to evacuation sites. There's so many different factors that contribute to not just disaster literacy, but also the fake news issues and the impacts that has on disaster management. So let's move on to the third question. Faisal, I guess you're up again with the answers or insights, if you will. We don't expect you to have answers for everything. So I think across the world, COVID-19 demonstrated significant bottlenecks around data management and how reliant it is on policy and regulatory coherence, and particularly coordination. We touched on this in the first question, but I wanted to ask, we talked a little bit in the first question, we talked about what are the challenges, but maybe we can talk a bit about the progress, and how COVID-19 has maybe opened our eyes to opportunities that are available for improving, policy and regulatory coherence around data management. Faisal, I'll ask you to kick off. You raised some issues this morning, but others to join in on where we've seen how COVID-19 has been, while it's been a devastating to everybody, has also created opportunities for change.
Yes, Tanika, I think the COVID-19 opened up a lot of doors in terms of how we start to see the way we work in terms of data sharings, data management, data governance, and a lot of issues of the data literacy. So I think it's the biggest opportunity for the changes. I think we see that. I think the government also realized, and then I think you see now how the COVID-19 data has been centralized and it's been used for the different kind of mechanisms. I think data standardization is being tried to apply in a different context. So I think it's a big opportunity for changes. It just, I think what really important that we don't miss this opportunity by looking too much into the details of technical issues and left behind, for example, the policy, the SOP, the regulations. So I think it needs to be balanced between the whole technical kind of aspects related to how we can do all data management, data literacy stuff, while at the same time make sure that all these kind of technical aspects could be supported by the policy and regulations to make sure that it will be going smoothly. I think I think it's important, an opportunity for us to be able to communicate to the government, also to our stakeholders. Thank you.
Yeah, thank you, Faisal. If I can sum that up, basically what you're saying is, when we start to see the opportunities, we also need to look at as you say, the bigger picture, sort of the enabling environment for data standardization and governance and stuff to really happen, consistently going forward, and not just related to COVID-19, but across the board on disaster management. So that's very helpful, because often when we talk about data management, sometimes it can be a bit off-putting when we think that it's just very sort of technical. It's very sort of about the technology and not so much about the policies, as you talk about, the coordination, the sort of the actual human beings behind the system. So thank you. Any other inputs from others in the group around the opportunities that COVID-19 has presented related to improving sort of data management and data governance? Yes, please go ahead.
Danica, thank you. I was thinking that actually, the crowdsourced efforts have been found to be very helpful, because we need to do some design thinking and also systems thinking, because we need a whole of system approach, a whole of governance approach, to really bring in academia, private sector, and also the government to work together. So if we can actually do that, then we will be able to arrive at some meaningful analysis. So crowdsourced efforts using GitHub, where we have access to data sets which can be then interpreted and analyzed by various groups of professionals, multidisciplinary professionals, was found to be really helpful. So we could actually look at that possibility, but we need to have very clear definitional categories, because how do you really look at a case, a person who is infected, a person who is recovered, a person who is actually undergoing treatment, and also issues like long COVID, the people who have recovered who are still having issues. So I think multidisciplinary groups of people, including epidemiologists, data scientists, government officials, computer scientists, will be very helpful. Thank you.
Yeah, thank you. That's very helpful. The multidisciplinary approach, but also just thank you for raising the issues around design thinking and systems thinking. These are topics that are really gaining ground, generally speaking, across the development sector. So it's important to to understand that it's not that it can be sort of contextualized into specific issues. Professor Fatma, do you have any sort of inputs or comments on this particular issue? I know we talk about data management, around COVID-19 as somewhat of a technical issue, but when we're talking about using it in terms of communications, what opportunities has COVID-19 presented in that respect?
I think I probably would like to invite our colleagues from KPCPEN or National COVID-19 Control, Mas Basra, would you like to share about this?
Yes, Prof.
Yeah.
Fatma.
Thank you.
Okay. Okay, thank you, Prof. Fatma. Hello, Ms. Denika. Yes.
Hello.
4.3, right? Yes.
Yes, please.
Okay. Yes. My name is Basra. I'm from public communication team for COVID-19 handling and economic recovery. And for this point, I think the government have a strategy. Yeah, memang learning by doing, right? We made many ministry collaboration, right? In one forum, we have one WhatsApp group, right? There is many sectoral ministry like health ministry, MOHA, right? It's important for the sectoral mitigation of COVID-19, like social ministry, many related ministry that relate to the issue of COVID-19 response. Like, and we have, I think we focus on production of the communication product, the data management, right? And for the second step is the distribution of the regulation. We know every week we have a change of regulation, yeah, the PPKM, yeah, the instruksi Menteri Dalam Negeri, right? We know that the regulation from MOHA, we change that bi-weekly or sometimes weekly, right? For the leveling of the zonation. But now we learning that the effect of the change of the regulation and the communication is very dynamic, and we have good practice on the dissemination. We summarize the difference of the regulation, the difference from the 2 weeks before and now, and we summarize that. We give that to the communication team of every local government, right? From the Dinas Kominfo. Kalau we know that the communication and information ministry, right? We have the structure on that. We have defined and recognized that, and we support that structure, right, to focus on distribution. And we have also many organizations that we can support for participation. We know that the regulation is clear, the distribution is clear, and now in the participation of the regulation, we have the pentahelix sector, right? We have the forum of that represent pentahelix in national and subnational government, and we evaluate the significance of the production, the distribution. We have also the knowledge management model of the update COVID-19 information. You can click on s.id/info-vaccine. We query all the information of many sector of COVID-19 response information in that link. I think that's what can I say to this forum now. For further discussion. Thank you, Ms. Denika.
No,
Thank
that's
you,
really
Fatma.
helpful, actually. Do you know what I picked up on the most is when you talked about communications becoming more dynamic. And I think that, we're all quite used to being communications. It's become such a bureaucratic process. And that, COVID has basically forced so many different stakeholder groups to treat communications as you say, a more dynamic process. of who's involved and what information goes out and how to coordinate and communicate. So that's really, I've noted that down in particular. And I think also picking up on what you mentioned about the pentahelix and just how important that is when we're talking about how communication, particularly in disasters, is dynamic. I think we can discuss the role of the pentahelix. And for those who are not familiar with the pentahelix, it's an Indonesian government concept around sort of the multi-stakeholder approach to disaster management, which focuses on government, civil society groups, private sector, universities, and media. Of course, there's a wide range of other stakeholder groups, or we could break down stakeholder groups. Civil society, of course, is a very broad term, but nonetheless, it's become a bit of a new sort of terminology that's widely used now to talk about multi-stakeholder sort of collaboration on disaster management. So it's very helpful. I see a comment in the chat, and thank you. Sorry, it's very difficult to see the full comment. I believe it's from Dia. Right, Dia, thank you so much. So you're, if any of the members of the group here have any best practices where COVID-19 data has been processed into information, and then information into, a specific information, I guess processed, you mean by analyzed, and then into communication, and the communication leads to behavior change. So, sort of that full process of data collection and into analysis, and then into risk communications that have led to behavior change. Thank you, Dia. That's really, really good question, because we definitely need to sort of, we can't just talk about data management and communications as sort of standalone or separate issues. They are very much linked. Any inputs from others who've see it, even small examples of that taking place within your own projects or your own institutions?
Lenika, may
Yes.
I answer this?
Please, go ahead.
From our previous survey to the community and also to the workplace. So for the community, the personal hygiene behavior is actually can be directed through the risk communication, a proper risk communication, which was evidence-based. So let's say, for example, if you would like to communicate that washing hands is reducing the COVID-19 pandemic transmissions, so we need to provide the data first, how much the washing hands and how the properly conduct the washing hands and things like that based on the evidence and the scientific beyond that. Let's say, for example, the virus will be killed by the soap for minimum 20 seconds and things like that. And then we communicate the risk into several medias, including the social medias and then the poster and things like that. And also the behavior monitoring supposed to be conducted. For example, in the workplace, we use what we call it the hero, the COVID-19 hero, or the COVID-19 ranger to monitor the behavioral change. This example is conducted in BUMN industries, BUMN ministries. So they use the ranger, COVID-19 ranger, to monitor the behavior change. So all the cycles supposed to be overthrough the cycles from the evidence base, and then communicate the risk, and then monitor the behavioral change by using, for example, the COVID-19 ranger or hero or something like that. Thank you.
Thank you. Yeah, I've heard of some different projects that have focused really on, the sort of really focus in on the hand washing as sort of the key behavior change that was needed for COVID-19. And I love the idea of calling them, COVID heroes or COVID rangers. Sometimes just putting it into sort of colloquial or sort of more, popular terms makes such a difference. I think sometimes we end up getting too technical about that. I can see a couple of comments in the chat. Faisal, yes, Faisal, you mentioned around sort of how you use evident data to turn to support the micro scale social restrictions in West Java. Thank you, Faisal, provided a link to review. It's in the chat for those of you there. Unfortunately, sometimes the chat is hard to see. Communication, vaccine hesitancy. All right. Oh yes, thank you, Dia, for basically governments and NGO other organizations using data to help people better understand vaccines, particularly those who have been hesitant about vaccines. A lot of that ties into the hoaxes that go around as well. So, combating hoaxes with using data to promote better understanding of what's happening. Yes, sorry, that was from Vinod. Apologize, sir. It's hard to see in the chat sometimes. So cool. Thank you. That's some really good examples. Let me just write those down so I can make sure to reference them in our in the plenary session. Very helpful. All right, we have about 10 minutes left before we need to start wrapping up and sort of putting together some of our recommendations for the plenary session. Let me quickly throw to the floor then around, the issue around disaggregated data, which is relevant both for, the technical issues around disaster data management. And not just technical, but very reliant on policies and regulations and the enforcement of such, but also in terms of communication and targeting communication to vulnerable groups. Without disaggregated data, we don't know where the vulnerable groups are. We don't know, how big the groups are, and particularly, people, for example, people with disabilities and such. From my own experiences, one of the key challenges, and not just in Indonesia, but in other countries as well, is that vulnerable groups tend to be sort of hidden and aren't always captured in the collection of disaggregated data, and so we often are underreported. So even when data is disaggregated, we're not targeting effectively enough particular groups, particularly if you're talking about people with disabilities. And secondly, then of course, the impact is that, of course, communications is not packaged in a way that reaches those groups. And secondly, the services are not tailored or sufficient to reach groups who have been underreported. There's lots of different ways to, combat this. Some are on the ground. Different organizations have different approaches to disaggregated data. There's key challenges around, how we define different types of different groups, and what have you. I apologize. And I'm going to ask, I believe Riza is here. Riza is here or not? No, I'm sorry. She was here and she has left. But maybe Professor Fatma, if you have any sort of experiences in terms of how disaggregated data, different types of strategies that have been piloted and what have you.
Yes. Denika?
Yes, go ahead.
Oh, okay. So about this aggregated data is critical. So we need from our previous experience and in the morning presentation, we clearly indicated that this aggregated data is critical because we have to align the risk communication based on the expectation and needs of the expected communities. Let's say, for example, for people with disabilities and also people with elderlies. So I think we have to tailor and align with their needs and expectation. So in order that our risk communication will be accepted by these targeted communities. And also to include the socio-cultural factors, for example, about the vaccines and also about the explosion of COVID-19 in some areas in Indonesia previously, for example, in the explosion of COVID-19 cases in Madura and Kudus, because I think we need to understand the socio-cultural factors, including also the acceptance of to be vaccinated in some areas, need to engage the local leaders or the either the religious leaders or influencers, local leaders. So I think this is very important in delivery of disaster management services and communications.
Thank you. Yeah, I think, we often talk about disaggregated data, as you say, around the sort of very technical sort of, the technology and what have you, but the socio-cultural factors as well is so important. And I think that goes back to what Faisal was mentioning before of, the opportunities that COVID-19 has presented is that we sometimes get too stuck in on the technology and not enough on the sort of enabling environment to make it happen. Yeah, thank you. That's good insights. I understand, Pak Rudy, you have a lot of experience working in this area, particularly in East Java. I apologize for pointing you out in the group, but maybe you could share some of your own experiences. Rudy, are you here? Okay, maybe not. Great, not. Very good. Okay. Pat Riza, I'm just going to call on you. One of the things that we're working on in the Siap Siaga program is the, working with the National Development Planning Agency related to sort of data management standards and access, what have you. And this, I think, is particularly important aspect when we talk about, how is that policy? It's not policy, but how is that work going to sort of account for not just the technical aspects of being able to access data and making sure the regulations abide by specific standards, but also how does it account for the socio-cultural issues around disaggregated data collection? Or has that even come up in discussion so far?
Yeah, on the data integration for disaster management program led by Bappenas, Denika, that we haven't discussed on that yet. the impact for the social aspect, social economy aspect, but more on like to share the what is actually the program activities by related line ministries, because talking about disaster management, there are more than 20 related line ministries and agencies involved in disaster management, but they don't really know each other on what actually program activities conducted by the others ministry. So this portal data catalog is is a platform to share this program. So to avoid a duplication in program activities in disaster management. On the disaggregated data, one of the our support for the planning bureau at the BNPB, where they requested, because right now there's no guideline for disaggregated data on gender, for example. So this is one area that BNPB, in particular us, for our support on to have a guideline on this disaggregated gender disaggregated data. It will evolve, of course, not just gender, but to social inclusion in the future. But at least a good start for the guideline on the gender disaggregated data.
Thank you, Pat. Yeah, I think, sometimes maybe we're putting the cart before the horse. We're talking about sort of the socio-cultural aspects of just collecting data or disaggregated data. But then, of course, if there's no actual policy or guideline on it, then, I mean, really, what are we even discussing? So very helpful. Thank you. I see, but you had your hand raised.
So I had just mentioned a point that the disaggregated data on age, gender, and wheelchair-bound and bedridden palliative care patients and people with disabilities will be very helpful to reduce the unintended exclusion of the vulnerable sections. Very often what happens is that these people get left out because the implementing agencies do not know that there are these people who need to be prioritized.
Yeah.
So especially for people who are hard of hearing or hard of vision, physically disabled, need sign language communication sometimes on television.
Exactly. Yes, very good. So I think, it's such a crucial thing. I mean, how to first of all, target communication to vulnerable groups, but secondly, how to deliver services if that data is not readily available. So okay, well, I am conscious of the time and that we need to be moving on to preparing some recommendations to present in the plenary session today. Let me just quickly go back over what we've discussed and I'll get feedback from the group if I may. So if we're talking about just around data management and communications as a multi-stakeholder issue, first of all, I mean, what is the baseline for that? And, common frames of reference when we're talking about data collection, when we're talking about communicating. Thank you, Faisal. Just one example of this is, of course, administrative boundaries. The only way for multi-stakeholder data management and communication to happen is for that data to, the interoperability between different sets of data. Between stakeholder groups. And then secondly, really to treat data management and communication, not just, it's not just about the technology, but also about the enabling environment in which those issues, exist. And we have to consider the human factor behind the scenes, which is as important as the technology that we use, both to collect data and also to communicate with communities. Just to make that point. Again, I think one of the key issues is, of course, across all of the issues that we've discussed today, is making sure we're not getting ahead of ourselves. Before we can really get into sort of the technical aspects of data management, data sharing, of communicating. Based on the types of data that's collected, we need to understand that why data sharing is important. And that's one of the key sort of enabling factors around multi-stakeholder approaches to data management and communications. On the issue around sort of fake news and hoaxes, I really love the contribution from Ibu Fatma, of course, talking about, if we need to understand what's coming in order, basically mitigate against hoaxes rather than simply just be responding to them. And that also that, a pentahelix collaboration around coordinated messaging is really crucial to avoid sort of conflicting messages, but also to get ahead of the sort of misinformation and hoaxes that can emerge, particularly in terms of times of crisis. And COVID-19 gives us so many examples of that as well. And similarly, in terms of communicating to improve disaster literacy, we often talk about social media, and particularly WhatsApp groups being the conduits for a lot of misinformation. But we also need to be able to take advantage of those same platforms to improve disaster literacy, linking information to official sources, being able to use different types of applications that support the targeting of vulnerable people with disabilities. I know, Faisal, in your paper you mentioned several different applications. And also, Ibu Fatma, different applications that vulnerable groups can use to be able to, listen to messages, or different ways to communicate, particularly people who have, disabilities and are not able to access the same types of information that others are. So that's another key point. Right. And then, what are some of the opportunities that COVID-19 has presented to us when we talk about data management and communications? We need to, first of all, make sure, standardization has been one of the biggest lessons that has emerged, and how important standardization is if we're talking about data sharing. And also just the interoperability between different organizations around data, and that we shouldn't miss opportunities to leverage the lessons of COVID-19, or leverage the progress that's been made from COVID-19 by focusing too much on the technical aspects, but look at the bigger picture. What can we learn for the policy environment? What can we learn from the regulatory environment? What can we learn just in terms of coordination? Those are key issues. And then finally, and tied to that so much, is to really take a step back. And by taking a step back, I mean taking more of that helicopter view, looking at data management and communications from a systems thinking perspective. So to help ensure that a sustainable change in data management, is something that can actually happen. And so we'll mention that as well. There's some really good examples of how data has been converted into communications for behavior change. I think, we often talk about communications and disaster management. It's very much about it hasn't always traditionally been for communication for behaviors change. So really, it's a good opportunity for organizations, whether government or non-governmental, to start collecting and understanding better the difference between communicating for awareness and communicating for behavior change. And so collecting different stories of how that's worked is, I think, an important step going forward. And then, just some key sort of issues just around sort of the socio-cultural aspect of communications in disaster management. Really that, this whole, it's so important to have the disaggregated data because it's, you cannot target communications to communities and expect them to be accepted if they haven't, the communications hasn't aligned to the needs and the expectations of the communities. And I think that's probably one of the biggest lessons around why disaggregated data is so important. Oftentimes we see a lot of disaggregated data, it's just around number of men or number of women. We don't understand why it's important. But then of course we need to dig deeper and understand around sort of the difference, in age groups, and also in terms of people with disabilities, etc. But again, the theme running through is not to get ahead of ourselves. We can't expect disaggregated data to happen, a collection to happen, and then, and then of course, be able to use it if we don't have guidelines on disaggregated data collection. And so that's a really critical aspect and probably a gap in many countries as well. So really need to sometimes we need to get back to the basics and really focus in on what are the key gaps, what are the key bottlenecks to making sure that this type of thing can happen. So I've run through that very, very quickly. I apologize. But I wanted to make sure that if there was any other issues that others in the group felt were absolutely critical that be raised in the plenary session today, or if anybody has any concerns with any of those key issues that have been discussed, the opportunity to please fill the gap or tell me that I've completely missed the point with some of the discussion that's taken place today. I see Pat Noto laughing at me, so either he's laughing and off base, or he's laughing because I've told everyone this is not my area. This is not my area of expertise. So please.
No, I'm just curious, Danica, about it's all related to disaggregated data as well. Again, I want to explore the technological solution. So probably I'm going to put again Faisal on the spot on this, if he can answer. A lot of countries now these days, they have been using a single IDs. Meanwhile, this is not what's happening in our region, right? With single IDs, actually, it's almost like you have all the metadata available there. So if you want to collect disaggregated data, it's not a problem. Or the easiest way is probably we can also promote the use of single sign-on for the different application instead of creating new IDs for the different applications. What happened in Indonesia, for example, right now we have the Peduli Lindungi, and it's all again another set of data being collected instead of using whatever that's available out there already. What's our take on this? Is it good, or is it worthy of exploring, promoting single sign-on or promoting the use of single IDs in our regions? Faisal.
Thank you, Mr. To. Well, that's really observation and comment on that. I guess we start to see it. I mean, if you're using Peduli Lindungi, also that now Gojek start the beta versions for you to be able to check in the different kind of locations. It's like Peduli Lindungi kind of stuff. So I think COVID-19 bring a lot of stuff with us, especially related to the data. I mean, Now the data of the testing one or tracing is also being collected and centralized by the government. So it's going there. I mean, also our registrations within for the ID card is now also start to be collected to be able to connect with different kind of data sets. So we're going into that direction. But like I said before, like to the Nika, it seems like what we're doing so far, it's so much on the technical kind of part, but we haven't really seen so much on the policy kind of aspects. I think this is the opportunity for us also to remind agencies, to remind our governments, to saying that it's a really good initiative, but just keep in mind also that those kind of aspects that we've done now, it's also followed by SOP, by regulations, by policy, to make sure that at the end of the day, we can review it back, we can see what is the things that we need to improve, those kind of stuff. Because ideally, I think what I presented in our paper related to the service design applications, basically, we have to look in the three aspects. The front end, where usually only users can see, but we also need to put more effort into the back end, where we're trying to support the front end, and at the same time, at the end of it, we try to make sure that all of these kind of things from the back end to front end it's been supported in a way that all the policy regulations can make sure that these things can be moved forward smoothly. I think that's my takeaway. Thank you, Panoto. I hope that answered.
Yes, thank you, Faisal.
Yes, thank you, Prof. Faisal. I appreciate it, and thank you also to Ibu Fatma and her team for all of your contributions and insights to the discussion today. And thanks everyone for joining and taking the time to contribute or listen. We really appreciate your time. I'm going to ask everybody to now please return to the plenary session. You can do that by clicking. Is Patno 2, is it click the leave room, or at the bottom of the screen? Yeah, no, you click leave room. That's it. We'll be returning to the plenary session shortly. And in the meantime, Jamila Mahmood, who was part of one of the advisors in Malaysia on COVID-19, will be sharing her experiences in the plenary before we get back and do the feedback to the plenary session. So please, if at the bottom of your screen, you can click on leave room, and we'll be back with you very shortly to listen to all of the different groups' feedback to the discussion that was held today. Thank you again.
Thank you, Danica. Thank you, everyone.
Thank you, Pat.
Good afternoon again. I think everybody is back in the plenary room now by the looks of things. Thank you all very much indeed. I understand, well, I was flitting from room to room, very, very interesting discussions, which I think will drive us towards some very useful conclusions by the end of today. Whilst the three speaker teams are madly beavering away in the background, we're really extremely lucky that we've managed to get Dr. Jamila Mahmood, a friend of mine from Malaysia, to come and spend some time with us. Jamila spent the last 18 months working to support the Malaysian government's COVID-19 response as part of her responsibilities as senior advisor on public health there. She's sat in cabinet meetings, she's hiked up mountains in Sabah with a syringe in her hand to take vaccines to the people. And she's done all of that, of course, with a very broad experience of a wealth of humanitarian and disaster management experience. So she really, I think, has something of a kind of unique insight into what we're discussing here today, this kind of confluence of, or this impact that COVID-19 has had on disaster management. And it's been very interesting to listen to some of the discussions that we've kind of, that COVID-19 has somehow a little bit been pushed to the side as we focus on some of the longer term problems that we're facing on disaster management. So I'm hoping that Jamila can kind of help to drag us back a little bit and say, there really is a connection here between
between these two. She's also just taken up a new role. She is the Executive Director of the Sunway Center for Planetary Health. And I'm going to ask her to share a little bit of information with us on that as well. But Dr. Jamila, very warm welcome. Thank you so much for taking time to be with us. I'm going to throw 3 or 4 questions at you, if I may, over the next 15 minutes. And I think, the best place to start is really, we're moving into the conclusion of discussions that started 4 or 5 hours ago, really intense discussions. It will be really helpful as we kind of move into the final plenary to get your first-hand experience and views on how COVID-19 has impacted the region's ability to manage disasters.
Thank you very much, Oliver, and really a pleasure to be here. And it's really nice that this is kind of like a conclusion to the process of the regional discussions we've had, which I've been privileged to be a part of in the initial phase. And it was interesting that all the different groups are talking about things which are essential to good coordination and successful crisis management, good governance, good partnerships, and very clear communications. And I think in COVID-19, we saw that this was really the determinants. These are the determinants of whether a response is successful or not. What I got from my experience up close and personal with government, and as someone who's worked in crisis for so many years, is it's not that different. Managing a COVID-19 pandemic, we don't have to reinvent the wheels. The tools that we manage other crises with, whether they are disasters or conflict, are fairly similar. And I think that the leadership that is required will be similar to whether you manage an earthquake response or whether a pandemic, except for a much heavier emphasis on the health side. If I can just talk about the region itself, I think the Asian region, or the ASEAN region in particular, hasn't done too badly. We've had our spikes and we've had our surges, but as a region, we have been able to get assistance to where it's needed. But what was really surprising for me, and I think it comes as well, it shouldn't be a surprise to me, is that national interest always supersedes regional interests. So while we were all busy running around trying to control the disease outbreak, I think very little thought was given to thinking that we're not strong if our region is not strong, that the borders are porous, that the pandemic will behave in a way that mutations will happen as long as one part of the world is still having a very high number of cases. And this is precisely what's happening right now. This is why we are going to be 2 years into the crisis, and we're still like hamsters on a treadmill, still trying to play catch up sometimes. And again, the other issue is around equity. I think we've seen this with vaccines, where some parts of the region have more easy access to vaccines than others. And if we had thought through a little bit about how that equity could have been more evenly distributed, I think it would have helped the region as well. So I think bottom line, Oliver, my takeaway is that certainly the 3 things that has come out of this symposium, strong governance, good partnerships and collaboration and clear communications are needed, whether you are in a pandemic or otherwise. But regional collaboration could have been strengthened for us to do a little bit more on research, collaboration, thinking out of the box on what might be what might be possible in our region.
Gosh, okay, so if I hear you right, we've got the 3 areas of inquiry that we're looking at as part of this process align quite well with what basically is needed to effectively manage something like the COVID-19 pandemic. Yeah. Super, thank you very much indeed. I think that was really helpful. Let me reflect a little bit back maybe and get some of your experience from before. I mean, I guess a lot of colleagues in the room today are going to remember that you had the very challenging task of managing the preparations for the World Humanitarian Summit back in 2014, 15, 16, I think. I mean, I'm trying to think back, but my recollection is that we did have some discussion around kind of global threats and challenges, and pandemic definitely came up as part of that set of discussions. But were we, I mean, if, you know, with the benefit of hindsight, because it's always a good thing to have, but with the benefit of hindsight, were we anything like as prepared as we should have been for the humanitarian consequences of the pandemic? I mean, it's interesting to hear what you say about we did okay in Asia, but still a lot of people, I think, have suffered and find themselves in very difficult circumstances as a result of the pandemic.
Yeah, I think no one did okay, right? But I'm saying that, you know, our our region went through those waves, and I think we've come out, you know, fortunately come out of them. Oliver, I think that, you know, we can beat the drum until the cows come home that you need to prepare for things like this, because we all saw this coming. If anyone says they're surprised about this pandemic, then obviously their eyes weren't open. We had all the telltale signs that the pandemic was a matter of when and not a matter of if. We ran all sorts of contingencies and then we forgot about it. And I think that that is a real shame. And if anything, you know, let this pandemic be that moment of reflection for all of us that we have to keep working at it. You don't just do it for 1 year or 2 years. This is going to happen again and again. And I think that the pandemic itself is only one element. The impact of climate change, the climate crisis upon us, requires us to continually prepare, adapt, mitigate as much as possible. So the World Humanitarian Summit really focused around risk and preparedness. There was even a push to have a some kind of council or threats commission, and I think WHO is also looking at a global threats council for disease. But we've got to go beyond the siloed approaches of pandemics, disasters, climate, and so on and so forth. If we're going to look at threats, we have to look at it holistically. You know, a climate crisis doesn't pause in the middle of a pandemic. So I think, you know, slowly we're seeing some of this emerge. But I want to touch on one very important thing. Whether it is a disaster or a pandemic, listening to people is critical. And gaining the trust of public and communities to then take the action that's required at their level is going to be critical on how you come out of this. Now, the trust deficit, you know, in many countries is real. And, you know, as long as there's a trust deficit, then obviously there will be people who will not comply to public health measures or non-pharmaceutical interventions, as we call it in the health sector. And this is what is prolonging the crisis to some extent. The whole area around misinformation that stems from, you know, our ability to be able to use, you know, we have no choice but to use the tools, the social media tools and comms tools that are there, but also to be able to use and mobilize them quickly to also counter the misinformation that is arising. And it's even worse in a pandemic than, for example, a disaster arising from natural hazards. So I think that, you know, that listening part is even more expanded now to not just be able to listen to people, but also listen to what information is coming out from these communities. And that requires us to be much more sophisticated in the way we apply our listening skills and communication skills.
So can I just pick up on that? Because I think this listening thing is really important. I mean, you're obviously speaking from experiences you've had in Malaysia on this. How was that addressed? How did you deal with that?
Yeah, I think number one is that, you know, it's at level, it requires a strong partnership, right? That is built between government, with the private sector, with public, with civil society. And, you know, in some, you know, unfortunately in Malaysia, there was a lot of challenges with that, you know, because our political situation, public trust with the government was you know, touch and go at most times. So I think civil society plays a very important role, and also young people. I think at the end of the day, it's about getting people who are young, who are savvy in communications to really understand that, but also not forgetting that, you know, how we communicate also ranges between communities, right? Well, for people in the urban settings, is social media and so on and so forth. But if you're going to get the word out on vaccines and you know that it's safe, it also requires us to go down to, you know, the village leader or the imam in the mosque to actually talk to their communities and their congregations about why it's important to protect yourself and therefore protect others. So, so that ability to have that, I would like to use the word humility, that not everybody knows everything, number one. But the second thing is using the right people to deliver that message. Whether it's a pandemic or whether it's a disaster, the same thing applies. So I think, you know, how do we, you know, I don't like the word interoperability because it sounds so military, but how do you become more able to have, you know, a talent pool that can actually pull on, you can pull on to harness, to really amplify messaging, but also to listen well and counter messaging. So we are fortunate because, you know, we have now a very strong health minister who's clearly communicating, has gained public trust, and that plays a big role. So I think, again, communications builds trust. Communications also alter behaviors. And behavioral change becomes very, very important in a pandemic.
Super. Thank you very much indeed. Very, very clear. So I'm going to challenge you now, because I think you've probably already done this, but I'm going to ask you just to kind of lay out, if you will, what are your top 3 takeaways or lessons around this kind of COVID-19 disaster confluence that you would like to share with us, that we should take away and maybe think about in the context of what the conclusions that we reached today?
Well, COVID-19 was a very, very important moment of reflection for me, because even before the pandemic, I was already thinking that we as humanitarian workers or development workers are always, you know, trying to play catch up and treating the symptoms of whatever crisis we face. And we never sit down and reflect on why we are in this situation. And this is why, you know, the Sunway Center for Planetary Health was born, really to address, you know, the drivers of crisis. Now, the pandemic didn't happen out of the blue. It's us, it's our human behavior that has allowed us to violate our planetary boundaries, and therefore, you know, allow for zoonotic leaks, or, you know, the virus jumping from animals to humans. And our overzealous consumption, you know, this quest for development and wealth has led us to this place. So we, you know, you almost have to rethink, you know, whether it's a climate crisis or not. How are our individual human behaviors contributing to it? How are our policies developed that will actually protect us by protecting the planet as well and protecting the environment? And therefore, you know, what kind of measures need to be taken, what kind of incentives and disincentives that we are able to implement beyond the ticking of boxes of the SDGs or ESGs or whatever they're called in the corporate or in the public domain. So I think, you know, it is really about making it clear to others. And again, communications comes to mind. You read an IPCC report, you know, code red for humanity, but what does that really mean? You know, to this climate scientist, it's clear, but what does it mean to the person who's running a food stall in the market? Or what does it mean to someone in corporate sector who's developing a new car? So, you know, so how do we now, you know, translate that science into easily understood knowledge that then can be really internalized and influence the change at behavior or corporate or community or government level, that will then help us really, you know, build better for the future, right? I mean, we have the choices, we have and we're not starting from zero. We are so sophisticated now. We can put people up in the moon. So it's not like we don't have the technology or the science or the experts. We just need to reorientate our thinking. And I hope that, you know, through the center, we can not just influence particularly the Asia Pacific region, but bring our expertise to the rest of the world.
Oh, that's interesting you touch on the center. I'm very interested to learn a bit more about this, and I'm sure the audience is as well. You've just been appointed executive director of this new center at Sunway University. Do you want to tell us a bit about it?
Yeah, the center, again, is really to orientate our thinking, but also to, and I believe that education is the way in. You know, if we can build the next generation of leaders that will think about, you know, the planet, then it's very, you know, it's going to help us to address all the issues that we're facing, whether it's a health crisis, a climate crisis, or even a financial crisis. So the center itself is a center of learning, obviously, that will apply learning and knowledge, but also influence and engagement with policymakers so that research doesn't just sit on shelves, but is translated into action. And one way is that, you know, the center itself is really a pioneering center that the university will apply planetary health through its every single faculty that it has, whether you're doing engineering or arts and humanities or culinary science or mathematics. You have to look at it, what is the impact on the planet and what I'm doing? And the reason is that, you know, if you don't have a healthy planet, you can't have human health. And we need both to thrive, not just human health to thrive, but we also need the planet to thrive, and we're all interconnected. So, you know, we started it in Asia Pacific. It's the first, I guess, you know, dedicated planetary health center here, certainly one of the very few in the world. And planetary health itself is a fairly new concept that arose out of a Lancet commission in 2015 and really drives the message that, you know, whatever we do, it's all interconnected. You cannot have human health without planet health.
And I think that's a very good moment to say thank you very much indeed. That was extremely helpful, I think, just in terms of helping us to pull our thoughts together as we go into this final plenary session. Thank you so much, Dr. Jamila, for taking the time to be with us. If you'd like to stay a bit and listen to what we're talking about, you're more than welcome. If you need to get on, we'll completely understand that as well. But I really appreciate the time that you've provided to us today. Thank you very much indeed.
Thank you, Oliver. And nice to see all my old friends there. Adelina, I see so many people that I know. Pak Syed. Of course, Nan. Yeah, thank you so much, everyone.
Thank you very much indeed. Okay, I think we'll press on. While we've been listening to Dr. Jamila, our colleagues have been busily working together behind the scenes to pull together the outputs of the 3 working groups that you all participated in during the course of this morning and this afternoon. I think we've had a bit of a challenge in just trying to capture everything. I was hopping from room to room, and there were some really interesting discussions going on, a lot of things to think about. How we pull all of that into a coherent whole during the next hour and a half, I think is going to be, or hour and just an hour and a bit, is going to be quite an interesting challenge. So I think the best way to do that is to basically make sure that everybody who's still in the symposium, and I think we have close to 100 people still in the symposium now, we probably should just share the outcome of those 3 groups, because not everyone can sit in every group. So I think let us start probably with the technology and communications group, because they posted their PowerPoint back first. I think if the facilitators from those sessions could spend 10, 15, 20 minutes, however long you need to coherently communicate what has been discussed and what the arising conclusions from your discussions this morning and the afternoon have been, that would be really helpful. And I think once that's done, we'll probably have about half an hour left at the end, just to kind of think through a little bit how to structure and shape that. And I'm going to ask Pat Syed Faisal if he will help me with that, because I think you probably all know he has very good facilitation skills. So we'll ask him to provide us with a little. Sorry, I know that's a bit of a surprise, but I like to surprise you, keep you on your toes. All right, let's start in that case. So I think, Danica, if you're ready, let us start with the technology and communications group. Over to you. And there is a glitchy pause. Ah, there you are. Hello.
Yeah,
Hi.
I was not allowed to unmute myself, apparently.
Okay, all right. Over to you. Thanks ever so much, Danica.
Thank you. Yeah, apparently my reputation precedes me. But anyways, thank you, everybody. Yeah, we had a really interesting discussion this morning. Fantastic presentations from Pak Faisal and from Professor Fatma. Can I ask for the presentation, the PowerPoint from group 3 to be put up on the screen? Super, thank you so much. All right, so I will run through sort of the conclusions that emerged from this morning's presentation and first discussion, followed by the questions that we prepared for the focus group discussion this afternoon. So next slide, please. Right, so the group this morning discussed a rather diverse but nonetheless interconnected issues around data management and then of course communications, and particularly communications with vulnerable groups. So we emerged with sort of 6 key areas for further discussion. The first, of course, was to assess the role of local disaster risk reduction forums, the private sector, universities, just a wide group of the wider group of stakeholders that operate in the disaster management space, and how they can support the localization of disaster risk communications, particularly as this function really increases the quality of communications, whereby local communities are more knowledgeable about their problems, their needs, and their expectations, as well as the quality of the communications that has served to the community. The second conclusion from this morning, one of the biggest challenges to risk communications is that it needs to be accommodated on different platforms and accommodate different groups of stakeholders, but it also relies on data that comes from a wide variety of stakeholders. So whether it be government or private sector, from non-governmental organizations, social media, what have you. So it's a very complex space to be operating in. And third, the data disaggregation relies heavily on standard operating procedures, but that in turn relies on the clarity of policy, which is essential for tailoring risk communication to different groups. And oftentimes the policies around data disaggregation are not clear or they can be absent. Fourth, data privacy remains such a big issue and a big challenge. How do we ensure accountability for the data that different organizations and stakeholders collect and then conversely share with others? What policies and guidelines are needed and how can these be enforced? Fifth, both data and communications is relied on relationships, both internally to organizations as well as between organizations, and not to mention their capacities to both manage data and coordinate around data management. And finally, the issue, which is of course captured global attention around combating hoaxes and misinformation. First of all, this requires disaster data literacy amongst communities. And an understanding of where to turn to when you need it. Similarly, government needs to be able to provide regular and reliable updates in order to increase confidence of communities in government communications. Can I have the next slide, please? So from those conclusions, we developed 4 different questions for our discussion this afternoon. I won't go into specific detail here, as most of the recommendations or the conclusions from the session go into a bit more detail. But in general, we really tried to identify the links between data management and risk communications across the board, both from technical perspectives, social perspectives, as well as learning from COVID-19 and the opportunities that we can leverage in the disaster management sector going forward. Next slide, please. So we call these recommendations not really recommendations so much as they are insights of areas where more focus needs to take place. So in the first instance on data management specifically, it's data management is in disaster management is increasingly relying on multi-stakeholder data collection and the interoperability of data across different stakeholder groups. It's therefore really important that baselines such as definitions around what beneficiaries, for example, and also of administrative boundaries is really crucial so that the different data sets collected by different groups, particularly in emergency response, can be used by each other. And then secondly, recognize that technology is an enabler of more effective disaster management and communications, but the human factor is still really critical. And sometimes we forget that when we start talking about all the technology around disaster data management. On the issue of fake news, hoaxes, and disaster literacy, really interesting insight from Ibu Fatma of being, the need to start treating communications as a mitigation tool, not just a response to the fake news and misinformation. She suggested that, we start doing media monitoring to understand the issues that are emerging and start to get ahead of those issues. And in this case, multi-stakeholder collaboration for more coordinated messaging is really critical. But conversely, we should also be using social media such as WhatsApp groups to increase disaster literacy, helping to link messages to official sources. There was quite a dynamic discussion around this, lots of different issues and ideas. We try to summarize into the key points for you here. Next slide, please. Right, okay, so leveraging the opportunities that COVID-19 presented around disaster data management and communications. First of all, one of the most important lessons that emerged is, first of all, I guess, the awareness and the recognition for the need for more standardization in data management, but also to look at the bigger picture and take a design or a systems thinking approach to avoid focusing too much on the technical issues, as I mentioned in the previous slide. Secondly, to recognize that communications has become very dynamic. Previously communications around disaster risk was quite a bureaucratic process with new platforms and multi-stakeholder approaches. This is not the case anymore. And it's really being able to recognize that how dynamic communications has become and the role of different stakeholders in the communications process will be really important to ensure that we're able to respond and adapt to the ever-changing context that we're operating in. Finally, in respect to learning from COVID-19, there's so many different lessons and examples of how data management has contributed to communications for behavior change, such as hand washing, vaccine uptake, and enforcement of social restrictions. And this is a really an interesting time for us to be looking into those examples in more detail, collecting more examples of that just around, to help improve disaster risk management and behavior change around disaster risks. And finally, around disaggregated data and inclusion, really need to look at the enabling environment. We talk a lot about disaggregated data and why it's so important, and it's absolutely critical for targeting, for service delivery and communications, what have you, but sometimes we get ahead of ourselves. Is there even a policy or regulatory process that guides the collection or even mandates the collection of disaggregated data? And in some cases, in many countries, there isn't. So, sometimes we need to take a step back and look at, we can say this is a really good practice, but is there a basis for that, those practices to be even taking place? And finally, really to focus in on the communications, if we really want to talk about being inclusive around communications, we need to align communication to the needs and the expectations of target communities, and particularly those of vulnerable groups. Otherwise, the messages just won't be accepted. And this process rests not only on data collection, but it also rests on the socio and cultural factors in the communities. And so this is links back to what we were talking about, communication becoming a much more dynamic process, and the need for multi-stakeholder approaches to communication, particularly with communities, in order to be more effective, particularly when we're talking about disaster preparedness and response. So that's where the group on data management and communications landed today. A lot of information to absorb and try to contextualize into some key recommendations, and I hope they were clear. I wouldn't say that they're recommendations as such, but definitely space for us to, condense our discussion down further and really distill lessons, move forward from that.
Absolutely. And Jenica, thank you so much for pulling all of that together. As you say, a very rich set of discussions and some interesting perspectives. Let's not say recommendations at this point, because I think what we're driving towards is really assembling a body of evidence. That's what today is about. So things that we can pull into the lessons learned, and there's certainly a lot there. The way we decided to structure this this session was not to have questions and answers after each PowerPoint presentation, but to have all three together with the hope that there may be some crossover. And certainly from my experience, particularly between groups 1 and 2, there's already some crossover visible and occurring. So I think we want to kind of look at that. So with that, I will ask that we go straight into the second presentation, and we're going in reverse order just to give Pat Said a bit of a break. So let us go, if I can, to Mia, who has been leading the session on partnership models this afternoon. And Mia, if you could please tell us what your group has come up with, that would be really helpful. Thank you.
Yes, thank you so much, Oliver, and thank you as well for the opportunity to facilitate the second group. It's indeed very rich and very interesting, dynamic, and I would say as well productive conversations with the group 2 on the partnership models, and I'm happy to share what we have put together as the outputs of the conversations. Can you please go to the next slide? So, concluding, from the morning session, there are 4 main points, that we agreed, and then take over, for the discussion in the afternoon. So the first one, we recognize that partnership takes time to form, and of course, then it needs to be nurtured, and also it needs capacity, and it also needs a quite, strong internal shift in many different levels, and required an investment as well to make it happen. So in the other words, partnerships really also need to be formalized within our system, and we also talk specifically on the internal systems within entities or within organizations as well. And the second one, it is recognized. The partnership is being recognized in the system, although at this point of time, more at the administrative level, and it's it's not yet really get into the deeper sense of the partnership as itself is not yet on the level to encourage shared commitment, shared interests, or even as well like the strong spirit of the partnerships itself. And the next one, we concluded that there is a need to recognize the power of the children and youth, but as well as the marginalized and at-risk group, be it like LGBTQ group, minor ethnics, and others, as the agents of change, like within the broader partnerships. So with that, then it's needed to, and it will have to draw attention to the specific needs of and the safeguard of that interest, the safeguard the interest of these groups, but as well as to address the global challenges and to amplify further, of the change needed or required. But in the same time, using that to encourage the different stakeholders to further engage the children and youth, but as well as the the marginalized and at-risk groups into broader partnerships in the future. And then the last one, that partnership, required a long-term investment, but as well as the needed flexible resource mobilizations. So this also means that it is needed a change of the, change of the paradigm or paradigm shift from what usually call or what being seen or understand so far as a competitive resourcing into a more shared commitments. So with those conclusions, then we drew some of the guiding questions for our discussion, which pretty much go around on how or what extent is things needed to make the partnerships happen more effectively, as well more inclusive, and as well ensuring that it's being recognized and be pursued, or encouraging more within the existing system. So some of the feedback or some of the inputs, and the good things, more of the inputs coming from the actual experiences from our participants. We put some of them into this initial key recommendations. Babari, next one. All right, so the first one, there is a need, the recommendation is for showcasing the data in the right way, of course, and to present more the evidence-based example to the different stakeholders. So this is as well, not necessarily. Sorry, something happened. Can you?
What happened, Mia?
Oh, okay. So can you hear me?
Yes, loud
All
and
right,
clear.
that's good. Yeah, so showcasing the data in the right way to present more evidence-based example for the different stakeholders. So that's not only on the. Okay, I think. Apologies for that. This is the wrong presentation. Can I just stop that and then share my screen?
Yes,
but
indeed.
yes. Apologies for that. Let me just pull. Can everyone see the presentation now?
Yes.
Okay. Now I share it from my own screen. Yeah. sorry for like that glitch. So go into the recommendations. So the first one, really, the first critical one, as we recognize the partnerships takes time, and then it's not only happen overnight, and then it needs, of course, a lot of energy, resources, finance, and of course, commitment. What's being recommended, like that there's a need to internally build partnerships, understanding, awareness, and practice at the individual as well as institutional level. So how can we do that? We, like the example such as putting the partnerships as the key performance indicators, but as well as developing the partnerships guidelines, which is adaptive, with on the changes on the context, or like any changes happen that may impact the sort of partnerships processes as well as the models, and capacity building and others also. Additionally, then like at the general level, it is needed like for us to recognize partnerships as part of our system. On the second one, there is a need to showcasing the data in the right way, and like specifically emphasizing on the need of data disaggregation, and as well, like the quality of data and the validation of it. So maybe it's also like linked to what the NICA, like group has shared before. And like with that, build more evidence-based example to the different stakeholders, which like include all like the different stakeholders that being part of our system. Of course, like more specifically ensuring that we include the children and youth, marginalized as well as at-risk group, and then making strong proof of the process itself. The next recommendation, like, is to really for like for us within the system to move away from the approach of call for proposal, and like, and then moving toward, or like, or come like together more on solution building together, which also like can include for example the joint explorations approach, be it like joint research planning solutions, and also like joint design and other things. So with that, like, or by instilling like that kind of paradigm, like this will make partnerships more as a common practice in the future. And the next one is to really emphasize the importance of equal partnerships for different entities and roles. So that means as well, like with this equal partnership, it's the share of risk, but as well as accessible, like complaint handling across the different partners, and mutual respects and honest relationships. The next one then, it's about the committed in documenting lesson learned. So so making sure like all not only the best practices as well, but like the unsuccessful like story failures, but including on how to address it, be documented, but as well as shared using like the different platforms that either already existing or can be like built, but in the same time then use that to invest more in the capacity building through the different approach, either like mentor coaching and others among the partners involved. The next one is on the importance of the leadership of the leadership and capacity building. So like, so the more diverse leaderships like capacity within the local level, it's being recognized, like as a good formula for a good, like partnership. So like the more diverse as well, you can be stronger within the partnerships, and considering it, like it will help in engaging and facilitating, like more into into finding solutions for the issues, but as well as like toward the common vision. The other thing is on recognizing, but as well as starting to think to work more with the existing children and youth group, but as well as other vulnerable groups in the partnerships itself. So we talked, like before, particularly with the marginalized and at-risk groups. So it is needed, like for us to start thinking on how to, include them into the partnership. And the last one, partnerships, while like looking into these recommendations, but as well as looking into the practices so far, perhaps it seems that the partnerships may be more applicable for a long-term programming, but it's not necessarily so. So partnerships can be done for both long-term, but as well as like within the humanitarian programming. And what can be done is really to try to leverage, expand, or even like utilizing any pre-existing partnerships into like any humanitarian setup. So the other example, like to do this is through the preparedness cycle within disaster management. So ensuring, for example, with the contingency planning processes, that the different partners will be involved and like and have a shared commitment and have a shared goal as well, like into the process. So that's pretty much what we discuss and can share from the second group. Oliver, back to you.
Wow. That's really good. Thank you. Very, very rich and very, very, yeah, I mean, a lot to take away there and to think about. So let's I've been taking some notes and we'll come back with some thoughts perhaps when we've had the final presentation, for which I will call on my partner in crime, Pat Said, if I may give the floor to you. And then once you are done, if you would kindly join me and help to think through some of what we have heard over the last 20 minutes, that would be really helpful. But let me give the floor to you, sir.
Thank you. Thank you so much, Oliver. It's been a very interesting day for us, I think, listening to all of this. And we would like to share some of the thought and in hopefully quite simple way, because the topic is already hard. We are talking about governance and institutional leadership. This is will relate to the change humanitarian architecture. So it's a difficult subject, a difficult topic, but that's what it requires if we expect something to change. And what is interesting, before we move to some of the key summary that we have learned, that it's a lot of discussion at the end is about the shift toward a locally led response or local leadership in humanitarian action. So that been, I would say, 80% of the discussion. So why it is challenging? Because the option is not many. All of them are difficult option. We could go for the evolution mode, gradual change. Evolution usually inside, coming from the inside. And the consequence of that, it will take time. Or we go for transformation. That's also the driven by the internal force. It will take time. Someone will sacrifice from the internal system. We talk about disruption. That would be external forces. And usually that will happen if there is a strong reason for internal actors to get into the system. And of course, the last one, which is what they call is something quite extraordinary, is a revolution. But another different game. So what option do we have in this, changing the humanitarian architectures, what we have discussed? We have two great presenters in the morning, Gabby and Adelina, talking interesting topic, and we have a discussion in the afternoon, in which thank you so much, Oliver, as well, for being there and share some of your interesting experience. Can we go to the next slide, please? So this is what we heard, and we tested in the second session. There's some input as well, but very much aligned with this. So COVID-19 is led to many issues, many lessons for the nation. I think we have discussed this. So this is like an opportunity to for us if you want to have a change. I think we have a speaker said that, if we cannot change now, what do we expect? What bigger crisis do we want? If this big crisis, we very much, do not see many change to occur. And if we want to learn, this is the time to learn. And the space is there, everything is there. So COVID definitely provide quite a good space for each of the actors to exercise the localization and then in a different scale as well. Two, we understand in the presentation as well, a lot of discussion about, look, somehow COVID brought us to a different dimension of a crisis. You have disaster management and health somehow getting together. In some of the country, those who are in charge for disaster management is also getting involved in the COVID-19. I mean, Indonesia is an example. The overall person in charge for COVID-19 was the head of the National Disaster Management Agency, the BNPB. But then the question that we discuss in this, what we call second breakout group is, what option do we have? Do we want to have one agency with centralized power and authority to handle all different kind of crisis, or we choose to, separate the authority, capacity, and ability to handle a crisis to different type of agencies, depending on what type of crisis. This is something that we discussed as well. And we also discussed about the importance of not only the national government, but also the local government. National government is very good in terms of setting the national law, and also which is very much the source of budget is very much from the national government. That's what we have seen in COVID-19. So the national government also has what we call the authority to convene, which is calling all different stakeholders to get involved in the situation at the national level. But then if we go for the next conclusion, we learn as well from the discussion, people said that we should not just think about national government, and we should also think about local government, because they are at the front line when it comes to crisis, and they understand the context. Crisis is about understanding context, because we can have a different model and bring to the different crisis, it might not work. So understanding the context would be the key advantages of the local actors or local government in that case. So that is what we've been discussed. But then one of the speakers said, we cannot have a complete shift. One, we shift from national, and then we shift into a local. It need to have an interlink, the interface between national and what we call local government. It should not be the administrative boundaries approach. It should have a functional boundaries approach. So meaning that, you know, if you talk about disaster management, it should not be just one province, one district to deal with that without, and leaving the international, national actors, which is in this case Indonesia, for example, BNPB, out of the picture. So this is where the link will need to be established. And again, we talk about the crisis provide lots of opportunities to change. But again, this is we discuss in the session morning and also in the afternoon. It is about incentive and disincentive. It is not voluntary change. So one of the speakers, for example, say the approach of what would be the incentive for the actors to change. So in a simple word, when we talk about change, when we talk about transformation, whatever we call it, then a question of what is in it for me will need to be answered. Or, well, the so what? If I don't change, so what? So this is where the incentive, disincentive, what we call approach will need to be there if we expect, change to occur. Then we also discuss about law, and there was quoted by Pak Udreth in session 1. It's basically law, regulation, policies, is very much at the top of the food chain of this whole environment. You get one regulation, one law, there is a big chance if that being implemented, then the change will take place. So that is that one advantage. But the other side of it is about any government will issue many laws. And then the question would be, how do we have the interlink between one law, one regulation with others? This is something that remains a challenge as well. Next, please. So simple. I mean, recommendation is simple, but I think difficult to implement. That we have to admit. At least now we see the political momentum. Anything in the name of COVID will get the luxury of being in the first row of the priority, on the top of priority. And the question whether that momentum can provide opportunity as well for disaster management, for whether improvement, whether for change, for the whatever we want to have. Because momentum is not for lifetime. I don't know whether next year we'll have this strong momentum for the COVID-19 or things back to business as usual. And then the question number 2, we're talking about strengthen the governance. At the end, we talk about localization, internationalization, we talk about partnership. There will be a need about governance. It's about the system, rule, procedures that regulate how the actors behave in certain conditions. So strengthening a governance is a key. Is it difficult? As a challenge? Because we are talking about what model to follow, what set of governance. Even we talk in one of the session this afternoon, one of the speakers said, does it mean that localization, that you change the organization into the local organization, or basically changing the behavior into the context? Because if you respond to one area, then that area might have a different way of doing things. Now the question, which governance that we have to follow, or we have the pre-agreement on the governance that both parties or all parties involved can agree on before they start to collaborate. Invest in trust building. I think this has been like so many times we hear about this. I think that the challenge is because the shift toward systemic approach where the SOP, rule regulation become very strong, and then the foundation of the partnership, which is the trust, sometimes can be ignored for simple reason that It will take time. It's much easier to issue an SOP. You can get it done in a few weeks or a few days, but trust is a different game. So investment in trust building is in a long term will pay off. Next, please. These are questions that we ask ourselves, questions that we ask in our breakout session, then question that we ask to all of you in this plenary. We're talking about the need for regulatory framework to strengthen localization. What type of regulatory framework? Which part of localization that need to be tapped by regulation? What would be the appropriate approach for regulatory framework on localization or localization? So this is something that we seek your input as well. And then what are the challenges in forming the collaborative ecosystem and collaborative governance in humanitarian action? I think we heard that we cannot avoid or deny about the competition there. Now, how do we have a competing actors to work together? Would that be a possibility? Or is it back to what we have discussed earlier? As long as a good incentive to collaborate, people will collaborate. So what are the challenges? Is it just because of the different interests, different agenda? Then we have a very challenging situation when it comes to having a collaboration among humanitarian actors. Now, this is something that I think quite fundamental as well for the question number 3. We discuss it, and I think, again, more discussion will be required. How do we define successful localization? What is the finish line? How do we know that we have achieved into that dimension? Is it fully localized or 80%, 20%? How do we even define that 20%? How we define success, what success looks like, as mentioned by one of the speakers. So unless we go with this first, start with the end game, then it's very difficult for us to structure a way toward that end game. So if we don't know the end game, we get lost for sure. And then we'll continue to discuss about this. So this is something that perhaps need to be agreed. But again, the question need to agree by whom? 4 would be, what would be the incentive and disincentive for change, particularly for those that need to change? We discussed about this. What is it? What is in it for me? Why do I need to change? If I don't change, so what? So we think, would that be something that need to be there? We have seen transformation, evolution, revolution, whatever it is. There is this element that take place. So the question for us that we can discuss is, what is the incentive for those that need to change, then change? Or disincentive if they don't change? Now, this is also a very difficult, what we call question on the number 5. How do we enhance coherence in laws, policy, and regulation? Because so many ecosystem inside each of law and regulation. So coherence in policies regulation is basically the convergence of different ecosystems toward a common purpose. Now, before the convergence starts, then the common purpose will need to be agreed first. So this is something that perhaps some of the participants can share their thought. How do we enhance coherence? We know this is important. And what would be the what we call ideal expectation on the coherence? Any quick wins that we can go into this in terms of the coherence? So this is coherent in terms of disaster management law, public health emergency, for example, the combination of this and other things, including the localization. So we have a lot of things more, but this is some of the interesting what we call questions that we gather, we ask the second breakout group, and we hope that we can ask you. And we found some interesting comments. For example, there is a need for not to focus so much on the technocratic approach, because localization is about the ground, and then we have to have the more grounded approach. And when we ask about what is ideal, what is pragmatic, what is practical, and I think the answer was stick to the ideal, but then let us work smarter. That will conclude our presentation. Oliver, over to you.
Thank you very much indeed. Am I on mute? No. Okay, good. Thank you. That was fascinating, as were the two preceding presentations. I've been taking notes and just trying to kind of get my thoughts a little bit in order to try and summarize this before we kind of open it up for discussion. And I'm doing a very bad job of it, I think. But maybe there are sort of, I don't know, 6, 7, 8 things that we can start to think about maybe going forward. We came into this exercise with these kind of 3 baskets of issues around governance, partnerships, and data. Now, what I've heard over the last 35 minutes that we've been listening is that these things are being mixed up now. And what we're seeing is a kind of coming together of these issues and a recognition that they're complex and that they're interlinked and that it's not easy to untangle. But maybe we can kind of try and draw out some what I would describe as big headlines. I think about big headlines because they're the way you kind of structure a document that you fill in under the big headlines. And maybe the big headlines are something along the lines of the following. I mean, firstly, the issue of data. It's all about data, actually. Pretty much everything we're talking about has its roots in data because data is evidence depending on how sophisticated your use of it is. So we really need to see, I think, the recommendations from the Technology and Communications Working Group were really sound. And if you boil those down, we need a step change on how data is being accessed, how it's being used, how it's regulated, what our cultural response to data is, and what our knowledge and understanding of how data is accessed, processed, and used is. So that I think is possibly one area to look at. The second one is this issue of sort of disaster communications, where we're all talking about the difficulty of hoax or fake news, the use of the ubiquity of social media, and so on and so forth. So is the second question sort of something around communications, everyone's business but nobody's responsibility? Because we all make use of these platforms, but trying to get the truth out on those platforms is something that we probably need to focus on a little bit more as a discipline and a community. The third one would be this issue, this quite interesting issue, which came up in a couple of the presentations around sort of power versus vulnerability, and particularly I think around this children, adolescents, and youth, which Plan International was so kind as to put out there for us. Really, this kind of promotion of people, of young people as people with agency. We're seeing it. If you look at what's happening with the climate change movement, it certainly wasn't Joe Biden, much as he may not like me saying it, or the president of Indonesia, who's kind of pushing on this. It's young people. So their kind of agents has changed, as well as people who are vulnerable. So maybe looking at the narrative and the way that we are talking about young people would be useful. There's definitely a kind of strong push. My next point is there's definitely a very strong push coming across that we need to rethink this kind of competitive model that we're in. It's a competition for resources, and we kind of need to start thinking about how we move from that competition for resources to really looking at shared commitments. And I think looking at a little bit at the fact that the system, we all talk about the system, it's not really a system. It's component parts of a system. It's people with different tastes, interests, desires, driving factors that need to be brought together. It's a set of component parts that really need to work together where there's a need, and that needs to be inside a set of enabling rules, regulation, a framework, as Gabby so articulately explained this morning, as I think everyone's debated. We need to look more realistically, I think, at the reality of incentives, whether that's money, whether it's power, relations, prestige, fear, and start to kind of think, how do we address these a bit more logically? Sometimes in my own experiences, but my reaction to people responding to incentives is sometimes quite emotional. I get cross because people don't behave in a way that is logical. They behave according to the way that their incentives are structured. So maybe some thinking about that or some reflection on that. And then I think, this point about, really drilling down into lessons and reflections. But how do you do that? How do you lay out a good platform on which those lessons and reflections can take place? I hope that today, we've done something like that a little bit. We've got very diverse voices in the room. We've made this completely open to everybody through fairly wide publicity. But really kind of looking at the principles of how you do that lessons learning process so that it's useful for all. And capacity building, fully take the point, I think it's really important. But capacity building for what purpose? And that, I think, is where this issue of kind of incentives and relations comes to the fore. Is it capacity building to do things better, or is it capacity building to do things like we do them? And I think it's important. It's an important distinction for us to perhaps think about. I think maybe the top of the list actually is, Batside, you said it very articulately from your group, capitalize on the political momentum derived from COVID-19. Don't waste this. We saw in the 3 or 4 years after the Indian Ocean tsunami in 2004, every country in Southeast Asia developed some kind of disaster management legislation. We saw within 6 years, every single country in ASEAN put into place a national disaster management authority that was legally enabled. We saw the conclusion of the ASEAN Agreement on Disaster Management and Emergency Response. And we saw a big kickstart to the international system figuring out how to change itself so that it was more relevant to those sorts of large-scale disasters. So a lot came out of that. I think it's a matter very much of identifying out of the difficulties. I mean, the difference, I guess, is that COVID-19 is such a broad, it's such a broad crisis affecting everybody, that figuring out what are the disaster management aspects that we may want to look at changing as a result of COVID-19 are the things that we've got to zero in on, and I hope this process is helping us to do that. And yes, I love this starting at the end game and working backwards. What does success on localization look like? What are our definitions here? Adelina, I think, made an attempt to define them, but probably we need to do some more work on that. And as I said, yes, this issue of laws, policies, and regulations. The tsunami was an accelerator back in 2004, 2005. Let's hope that COVID-19 can also do that, despite the horrors of what it's done to humanity. So those would be kind of those would be my attempt to summarize. But I am but one person. I think we have still with us a very large number of people. It's not showing on my screen right now. We have still 81 participants, which is great considering we've been going for 5 hours. So thank you all very much for staying the course. Let me ask for people's opinions, views, feedback. Backside, I know you are keeping an eye on who's in the room, so you may want to zero in on some people and ask them for their opinions and views, because I know you like doing that. Oh good, we're now side by side. So Backside, you may want to respond, or maybe you may want to help me throw this open to the group. I don't see any hands raised yet, but I have my view in the wrong way. Backside, over to you.
Thank you, Oliver. I think we need to warm up a little bit for people to raise their hand. But since we're working in the emergency response, we have a different rule, which is if within like 10 minutes, no one raising hand, will start picking up people and asking them to give a thought. And we have
that was where I was going, but I was being much more polite about it.
But I think what is interesting, Oliver, from what you have summarized, which is interesting, a lot of issues, but at least for me, some of the thought would be in form of a question, is separating what would be the primary problem with the secondary problem, what are the upstreams problem and what are the downstream problem. So because now we get this mix, and this is something that is important, because there are two ways of looking at this. One, this is an intellectual exercise, which is interesting. We enhance our knowledge, our understanding about the issues. We can continue to discuss. But on the other side, we could see this as a problem-solving approach as well. Meaning that at one point, there got to be the execution of all these, what we think are good recommendation. So the question whether anything that we can do, I mean, from the audience, that we can consider as, for example, a quick wins in whatever issue that we want to address. Because at the end, change occurs when we have, when the transformation is taking place, meaning execution. So that is a dimension that really affect change to occur. I think I have Danica raising hand.
Thank you, Pak Faisal. Yeah, I actually wanted to come in and comment on, because that's the second time you've mentioned quick wins, actually. But you've also talked about policy and regulatory coherence. And yeah. I think, I mean, I speak from the Indonesian context, but also several other countries in the Asia Pacific region where I've worked. And the issue around policy and regulatory coherence is huge. It transcends the region. And part of the problem is these quick wins, right? You have various different organizations and donors coming in and saying, oh, let's, you know, like, what's a quick win? Oh, we'll do this policy, we'll do this regulation, without really, you know, really doing that deep dive and considering what's the impact of doing this regulation or this guideline, and how does it fit within the bigger system across stakeholder groups. You know, in Indonesia, you know, you have the National Disaster Management Agency working together very closely with the Ministry of Home Affairs and the Ministry of Social Affairs, with so many regulations designed by all of these donor partners and development partners over the years that don't quite fit with what's going on in those other institutions. So while quick wins are important for that political buy-in to get that sort of ownership going, you also have to be wary of what quick win, you know, the downside of quick wins as well, if we want to talk about this bigger picture and focus on that transformation. So pros and cons, and just something I think as the sort of system thinking, design thinking sort of momentum really builds in the development sector, is something that we have to keep in our minds as we work on these issues.
Thank you so much,
Lucy.
Danny. Yeah.
Lucy.
Hello. Sorry, I don't want to make this a Siap Siaga team finale, but I did. I mean, I was really struck by what you were saying, Oliver, also about, you know, kind of data being at the heart of a lot of these issues. And I'm a huge believer in the kind of, in information management and data being the key to really effective coordination and decision making. And I'm obviously giving my Optra background away there, but the other thing that really came out for me today is, and I know that we all know this, but it just was sort of presented so clearly to me, is that this is actually around a mindset shift, and it's around a cultural shift. In the same way, we're seeing lots of cultural shifts around kind of, you know, in different parts of the world around, you know, inclusion generally, and the way that we you know, our kind of innate biases and so on. And so I think there is another element for me that comes out of this that is, you know, really about those soft things, and how do you create, you know, can you use our conventional tools like policies and, you know, SOPs and technology to create that kind of cultural shift in disaster management. And you know, when we were talking about things like trust, and you know, as Faisal was saying, you know, trust keeps coming up again and again. These are not things that we know how to really fix. We can point to it when we see it and we know it, but you know, as a system, you know, how do we actually start to creating those types of changes? And I think, you know, when you link that to some of the stuff that we're talking about in the kind of, you know, the sort of the you know, youth coming, you know, center and forward in some of these dialogues, and this kind of organic, spontaneous space that's been filled with different types of partnerships, outside of our system, you know, that's where we see it in evidence. But, you know, yeah, how are we as a wider system capitalizing and capturing that? So yeah, that was just my thought.
Thank you so much, Lucy.
Yes.
Anyone else?
Anybody else? If not, we'll start picking on people. Or asking people to give us a little bit of feedback.
Well, at the end, the speakers, we could also ask your views again, speaker, after listening, starting from presenting in the morning and then listening all the discussion. Perhaps you have something to share as well. But
Asad, before we do that, I mean, I'm going to pick on somebody, but he can say no if he wants to. But we have Takeshi Kamino here from the Asian Disaster Reduction and Recovery Network with this kind of really broad pan-Asian view and perspective. Takeshi, I'm wondering if you would like to just share any thoughts with us on kind of where we're at. You may not be listening. I don't know. Okay, no. All right. So let's go back to side. Let's go back to check in with our speakers. Over to you.
Okay. We start again. Sorry. From morning session. Now I'll give the floor again to group 1. Gabby and Adelina, and then we go for group 2, and then we go for group 3 for the speakers. And if the facilitators and moderators of the group would like to give their thought, please do so. And all participants, if you want to contribute, that would be very much appreciated. Just raise your hand. I'll go for Gabby. Oh, I think Gabby, I'm not sure there's still there's late
She
night.
may have gone home because it's late where she is. I'm not sure.
This is already 9. Perhaps might ask Adelina. Yes. Any observation from your side, Ibu Adelina, or anything you want to add? Anything that you missed during your morning presentation?
Thank you, Basaid and Oliver. I'm still thinking and processing because yeah, it's a lot to process since the morning, and I have talked a lot as well. But first of all, thank you so much for providing this platform. I thought that at least one of the things that I could do as the writers or the so-called experts that prepared the paper on localization and also on governance, perhaps we can start explore how to actually make the recommendation, push the recommendation forward into some practical ways. And one of the things that came up from the webinar that I helped Gabby moderating, and this is the Asia launch for the publication that Gabby also presented on the intersection between public health emergencies and COVID-19. One of the recommendations coming from that study is for us, at least in the Asia Pacific region, to come up with a community of practice. And who should be in this community of practice? It's basically trying to, capitalize on the momentum that never in history, right, that governments in the world are revising, putting in place regulations, laws, procedures, on public health emergencies. So there must be this great minds already, and they're like doing it while, they're developing the regulatory frameworks while doing it, right? And then they have to actually adjust from time to time. So why don't we come up with why don't we establish a regional community of practice on localization, right? If for example, for example, the regional mechanism, the official regional mechanism doesn't want to take it further. If I were still with ASEAN, I would push it. But if not, then we can get the ADRN, for example, or other networks, basically, who are the champions on localization, and then really bring the people who really believe in. But this have to be like a combination of people who have the data, the academic people that basically can inform each other, right? What they learn, and it should not be only on governance, regulatory frameworks, but also on others, including on data, communication, how to communicate, and so on and so forth. So I think if you're talking about quick wins, which I also don't like, because it seems like a short-lived, and one thing that we want to avoid is actually anything short-lived, right? But really capitalizing the momentum, and we have seen a lot of good practices coming from Asia and the Pacific region, including Indonesia. We have been the object of best case studies. So why don't we retain this knowledge, right, and allow this, and then for this regional community of practice to push it further to our respective governments, whoever we find advocates. So that's one. And then second, for the governments or anyone, okay, I want to ask you guys whether you agree or not that we move to a collaborative ecosystem, or you wait for this disruptive ecosystem that I presented earlier. So if we all agree that there has to be this collaborative ecosystem and use this collaborative way of doing things instead of a competition, there are actually a few steps that we can do. For example, stock take. We have pentahelix, right, for multi-stakeholder. How about Malaysia? What else, right? And then capitalize from that. But if we really want to have a collaborative ecosystem, making use of the different stakeholders, stock take, there are already networks of local NGOs in Indonesia doing a lot of work in preparation, link that to the response and provide the linkage, government, provide the linkage, but start with stock take, right? Knowing who actually the actors are and talking to them. So that these are the two. Perhaps we need to have another, another kind of like exhaustive, but if you ask me, I think start with something practical and prescriptive is okay, but something practical and really going back to my last slide, let's capitalize the moment and don't make it a waste. The experience and community of practice is a great start. Thank you.
Carpe diem, seize the day. Absolutely, Adelina. Thank you very much indeed. Very, very helpful. So we go, I think, to group 2, the partnerships group. Bu Shinta, if you are happy to give us a few thoughts, that would be really helpful.
And if I may,
sorry, Pasaid.
I may add as well, Ibu Arshinta, because please feel free to repeat key points of your presentation, because some of the people here were not in your group. So I think they would be interesting as well to listen, give this opportunity to listen from your presentation. Please go ahead.
Yes, Said, actually, most of important things that Bu Adelina has brought up is very similar to our reflections in our group 2, because in the conclusions I said to colleagues in group 2 is that the pandemic is very historical moments, and we do not have a chance to have a turning point. The only one and only choice that we have is just to collaborate and to have a stronger partnership, and not always starting something new, but utilize the existing one. And Adelina mentioned it very broadly about having community of practice in the regional setup, using the existing strong DRRN network or something else, but really something that we have within ourselves. But then also the points my colleagues Nia could also add on, the points that we underline in our discussion is that we have to move forward from the very paternalistic partnership, which we are talking about administrative things. We have some requirements that are set up by some ones that have more power. Move towards like something that working together. When we are setting up the partnership, when we are setting up planning or priorities, we can do it together. And actually, in our group, Takeshi reminded the audience, because his network and ourselves actually started what we call CLIP. This is an initiative where we started since the very beginning, the collaborations on innovative local innovations for climate justice and disaster resolution, but not something that's set up by the donors, but something that are set up by the local people, the local initiative. And this actually becomes one example that makes everyone feel enriched, feel everyone energetic, because we see that equal partnership, or this is not something that only put on the paper, but something that we work on and we worked on. I think I do not want to repeat many things that brilliantly mentioned by Adelina, but I welcome if Nia or Mia or even Lucy would like to add something from our group. Back to you, Pak Said.
Thank you, Bu Ashinta, very much. Nia, why don't we go to you? You're still on mute. Yeah.
Can you unmute me, please?
It's fine. You're good to go. We hear you.
Okay, great. Thanks. Firstly, thank you very much again for the opportunities, and also I think it was very well said by Bu Ashinta and Bu Adelina before. I think the platform has been a very good chance for us to exchange ideas and also to emphasize on very key messages that each of our group already shared. I would not try to share more. I think because in terms of reflections, we already included a lot in our conclusions and recommendations shared by Group 2 by Mamia earlier. So I just want to highlight one key, I think, quotations here that I want to quote from Mami Mizutori, who is the special representative of UN Secretary General for Disaster Risk Reductions, who said that only together can we make true progress towards a safer and more resilient planet. So within this Group 2 partnership models, we also wanted to highlight this and hope that we can work well and sustain these ideas together in the future, so that we can build more stronger partnerships together, especially supporting more with the children, adolescents, and youth, highlighting on the gender equality and inclusions in the partnership models as well, and also taking advantage of the technology, of the different innovations from the different groups in our community, so that we can build a stronger community and more resilient community together. So that's what I want to highlight and maybe emphasize here at the end of our symposium. Thanks again for this. Back to you, Oliver and Said. Thank you.
Thank you very much, Mia. Just want to check, Mia, I think you probably had your say, but is there anything you'd like to add?
Yes, thank you, Oliver. Just like one thing, and like this is the things perhaps not necessarily be answered fully in a team discussion. It's related on the emerging like parallel systems with the on the partnerships within the sector, within the sector, humanitarian as well as the disaster risk management. So I think this is as well like related to the fact in our discussions as well. A couple of participants, really talking about the needs to for the system not only recognize but to put a more structured system right on the partnerships that really clarify and then put on a specific roles, responsibilities, into the policies, guidelines, all those kind of things. But in the same time as well, what it's being seen, with that is more on the administrative as shared as well, right? But there are also the things, effective partnerships, that emerge that more organically outside, of the structured system. So the question is, on more whether it is needed just to allow, those parallel systems to move together, or to push them, into just one system. That's the question. I think it's also interesting because yesterday I just came out of a very interesting event in Bali where there's a declarations of the of the forum across the different districts and cities as multi-sectors forum for partnerships across different districts and cities in Bali. And the fact that they have been trying to have this forum for a while to get into the system, with the SK, with the decree and everything like that, it's not really happened. But then but then because of the push of and then the encouragement spirits of collective commitment and visions to just let's work together, let's put it into the forum together. Let's not wait for the ESCA, let's not wait for the decrees, and everything, and find whoever that have the resources in place and capacity in place, and then let's try to make it work to plan to support disaster risk management. And boom, within a short time they are all coming together, and it's covering all the different sectors, private sectors, publics, and public and people as well, the community. So yeah, it's still that question, whether we do want to allow these emerging parallel systems, or whether we need to keep pushing into just one system to work, or anything like that, a more structured system to work. Yes, with the policy and guidelines.
Super, thank you, very clear. Let's go to the final two speakers in that case. Bu Fatma, are you still online?
Yes.
Please, any thoughts you'd like to share with us?
Yeah, I would like to share from our discussion that disaster risk communication based on COVID-19 lessons learned are based on evidence-based. And risk communication is to determine key messages that would like to deliver to the targeted audiences, including the people with disabilities, elderries, and also by using local leaders, local language are more acceptable. And also how to make the risk communication into the behavioral change. It also needs to include empowerment, the local communities, as well as to also use the native and local languages by incorporating the community's expectation and needs. Thank you very much.
Thank you very much indeed. Very concise, very clear. So thank you for that. And let us go finally to Mr. Faisal Tamrin.
Yes.
Faisal, over to you.
Yes, thank you, Oliver. Thank you, President. I think I kind of like it what you were saying before, Oliver, related to that. When we're talking about system,
I thought you might.
You might say that it's the system is basically it's a part of some components within. I think during the discussions within our group, there's a mention about how technology will be playing a big role, which is, I think it's quite important. But if you're looking into our paper, we're not really talking so much about the technology, because we thought that technology is also something that could change, but it's not really a main factors, because I think we should see technology as enabling kind of tools that will help you to reach whatever kind of output that you would like to achieve. I think in some way what we're trying to say is basically that there is a paradigm when we talk about developing information system, where people usually sometimes only look from the output first before they're digging into the data. So they was like, oh, this is what we'd like to achieve. Now, how we get the data? Not really the data-driven kind of aspects, but it's really kind of output as driven kind of stuff. So that's why I think it's important when we highlight the issues related to the data interoperability, the lack of incentive, the data governance, and then also the working modalities, because what we'd like people to see when we're talking about developing information system, it's the overall kind of aspects that they need to look into it. What is the problem space? How you identify those kind of aspects that would be support and solve your problems, and then what is the solution space in terms of technology, in terms of the way you're doing your prototype, or in terms of how you define your user. So I think that would be most of the important aspect. That's why I think some of the key recommendations that are coming up from our discussion is talking about service design kind of implementation, where we're looking into people-centered design, we are looking into service kind of aspect, those kind of stuff. So I think that could be one of the most important aspects that we should also looking into, how those kind of the parts related to the problems, to the solutions and identification could be worked together to achieve the output. I think that's it from my end. Thank you.
Gosh, okay. Great note to finish that bit of analysis on. Where do we go from here? I think that's the good question. And maybe I go to Pat's side and say, do you have any immediate thoughts on what you've just heard? Because you usually do. And then I'll try and maybe summarize as we move kind of towards the conclusion. But Pat's side, over to you.
No, I think if we ask the question of where will we go, or where do we go from here, I think it's good to start with the very morning session. Representative from the government of Indonesia, as well from Australia. One of the similarity is about how the result of this symposium can contribute to two biggest events in disaster management and humanitarian next year, which is the GPDRR and also the EMCDRR, the ministerial meeting for disaster risk management. So that is the thing that we should put in mind moving forward, and looking at recommendation issues that worth bringing to that type of event. So that would be the end game of all of this part that we have done the webinar, we have done the symposium. And I think the challenge would be about what issues that worth taking into that regional event. Now, for me, Oliver, if you see my opinion, because at that level is usually a decision-making or decision makers attending the event. So issues that requires or issues that require attention of decision makers, usually fundamentals and primary problem, upstream problems. So that's something that we need to think of about all of that we discussed today. What are the key issues that if we bring it to the GPDRR or EMCDRR, whether that they've changed the name, it's something that can influence decision-making process at that big event. So that is basically, well, of course, another questions. And people ask why you keep asking questions. I'll say, why not?
I have an answer to that question, I think. Thank you very much. I mean, a couple of thoughts as we kind of move to the conclusion. I had myself all lined up to say, these are the 6 key outcomes of this event. I don't feel brave enough to do that because I think we have shown through the discussions that we've had today that there's a great deal of complexity to be worked through. But I completely agree with you. We've got to be really careful about making sure that we capture what needs to be captured for decision makers. But that doesn't mean, this is where I'm going with this, it doesn't mean that we exclude all of the other rich inputs and suggestions that we've had, which are aimed very much at us as practitioners. So the path I'm going down is to think of maybe a sort of 2-track approach to this lessons process coming out of the symposium rather than our 1-track, which was lessons learned to take to GPDRR. I think there are probably some extremely good seize the moment lessons that we do need to take to GPDRR and say, you've got an opportunity here on the back of this pandemic to make some moves towards real change. But a lot of this is actually also talking about the way those of us who are at the working level are working day to day on partnership issues, are looking at localization, all of the stuff that we've talked about during the course of today and how we influence people in positions of authority. So I think there may be sort of 2 tracks, as I've said, coming out of this regional symposium. In terms of the next steps, we now need to prepare a lessons document, which will hopefully go forward to these big events next year and hopefully some other events as kind of the region's contribution through this Australia-Indonesia partnership on disaster risk management. As I said, this will have to figure out how we're going to shape. I think probably we have a gentleman about to speak who can help us to think about how we shape that process. That is, of course, Dr. Raditya Jati, who is the Deputy Minister for Systems and Strategy at the Indonesian National Disaster Management Authority. And he's found some time to sit and listen actually for the last hour of what we were all talking about, and then to provide us with a few summarizing closing remarks. And if I can just say before I ask him to speak that he's been enormously supportive of this lessons learned journey. He's really helped to guide us from the start, helping us to shape the initial thinking around the 6 webinars that we held in the summer. He moderated the webinar on localization, so I know this is a subject very close to his heart. And also was a great speaker in the session that we held on technology and communications back in June. So I think he has a very steady hand when it comes to this stuff, good wisdom to share with us. So let me, if I can, now give the floor to Pat Raditya to provide us with his closing thoughts as we bring this to an end. Pat Raditya, if I can give the floor to you, sir.
Well, thank you very much, Oliver, for introducing and also giving some introduction on myself. And first of all, I would like to thank you this program and from Siap Siaga Regional Symposium, and I congratulate all the speakers that have been discussing since in the morning until this late afternoon. So again, appreciation from us, from the National Disaster Management Authority, BNPB, for this activity. And I think this is one of the input for the knowledge management that we should need. And we need to be as a tacit knowledge that have been to be alliteration and education for the next generation related on what will be done for sustainable resiliency, for sustainable development, especially related to the disaster and also during this pandemic situation. So first, I would like to say about the follow-up action, or maybe I can say that in the last minute, but first I would like to say about the Sendai Framework for Disaster Risk Reduction. At that time, and the closing remark before the Ms. Margaret Wurstrom, the Special Representative for Secretary General for UNSDR at that time, now it's UNDRR, she had mentioned that this is the first time that the pandemic included the Framework for Disaster Risk Reduction. That time in 2015, I was like thinking, what is pandemic and what is related to the disaster risk reduction? Now we're dealing with that in this year, and these 2 years. So I think this is a very, very important case that we can deal with related to the pandemic and to the disaster risk reduction itself. And then we try to promote what we call, since these 3 years, on sustainable resiliency for sustainable development. Why? Since last year, the president had signed or established the President Decree number 87, 2020, related to the Indonesian disaster management plan as a long-term 25 years. And what we call the RIPB, or Rencana Induk Penanggung Bencana 2020 to 344. And at that time, we need to achieve what we call the national resiliency in 2045, which means that 100 years, 100 tahun Indonesia Emas, or the golden 100 years after the independence, is we have to be resilience nation. So this is a target as a long term. So it's not only an end game, Pak Said, it's not only for next year, but this knowledge management, I think, is a starting point to collect all the data, the information that we need to have as a case for resiliency or disaster resiliency related on how to build the sustainable resiliency. Why I'm speaking about sustainable resiliency, because sustainable and resiliency is a complementary. We cannot reach sustainability if we don't have resiliency, and we cannot reach resiliency without sustainability. So I think this is a wording that we need to promote now, because we discussed this at that time 3 years ago in UNICR at that time. And okay, so this is from Indonesia, sustainable resiliency for sustainable development. So please, everybody, we can also try to promote these issues on how we can achieve, if I can borrow the message from Pak Said, what is the finish line of the sustainable resiliency for sustainable development? This is our homework for discussing what is the roadmap to that in the 2045 Indonesia Emas. And other thing about the GPDRR, we know that it will be we will be the hosting country for the 7th GPDRR that mostly is not held outside Geneva. So this is, I think, it's a good chance that Indonesia as a host country, especially in Bali, why I'm using udang, because I try to promote Bali this time. Mohon maaf Pak Mas Kanjeng Notonegoro, saya lagi jadi orang Bali. Jadi we have to promote Bali for the next year, because udang means dong, mudeng. It means that the knowledge is the best that we need to give to the world from Bali to the global action. So if you know the topic of the GPDRR next year is from risk to resilience towards sustainable development for all in COVID transformed world. So it's really related to the discussion for today on regional symposium in today, and I think it will be a very, very good input for GPDRR. Our next challenge is to discuss with the UNDRR if we can put this as a side event, as a learning lesson from the COVID-19 from Indonesia, and also regional symposium that have been held with Australia and Indonesia and all stakeholders related to with the Ministry of Foreign Affairs and also Siap Siaga. How can we give input to the global world that from this discussion and the papers and the knowledge that we have relating to 3 issues, we can put up this as a paper, or put this as a paper for the world as a lesson learned from the case that we have related to COVID, and also the impact of disaster management and resiliency. So I was listening for this couple of hours, and maybe 3 things that I can bring up to the issues that what we can discuss related to that. The first is about the commitment of the leadership. Why? I'm not going to say about the conclusion of the discussion for regional symposium, but maybe this can be enrich the issues and the discussion from today, what we feel in our side, our dimension from the government side, especially for national level, because as how we can coordinate vertically with the problem of the challenging, not really problem, but it's challenging for decentralization. So first is about the commitment of the leadership. We know that governance is very important. How we can tackle from national issues to local issues with the decentralization, and how do the active partnership, how we can change the paradigm safe to be from response to prevention, even in COVID, even in resiliency or disaster. How can we really make them as a mindset and as a paradigm shift from that? And you might say, if you say about the commitment of leadership, it will also relate it to the political will. Also, I will say also the social modality of the traditional wisdom. It will be very important to know that not every location is the same. We know that we have put the archipelagic state in the Sendai framework as one of the issues that really we have to encourage, that national or archipelagic state have more risk rather than any other country in mainland. We have coastal line and so on. So it means that with the archipelagic state, we have more challenge rather than any other country that doesn't really have any coastal line or a volcano and any other hazard that we have in the country. So I think social modality, traditional wisdom is very important issues in our case, even in tackling the COVID-19, that we really need a local wisdom, local leader. I would say a leader from the religious leader, and also from tokoh adat, tokoh masyarakat, tokoh agama. I can say that in English. And then it will also relate it to humanitarian equity, as we might say, not every island or cluster of island, it will be the same. The second thing I would like to say about the partnership model that you have been discussing for today, but I will say that every word with C, C, yeah, how we can do collaboration, consultation, coordination, coherency, capacity building, capability building, everything, every word with C, you can find it out by your dictionary. But the C coordination thing, the C, everything with C, it will be I think it's a model for partnership, even related to other stakeholders, and how we can really engage all stakeholders in collaborative way, cooperation, consultation. And you can say also the capability of the local government and so on, and how can we create the engagement, the collaboration to break the silo among all other line ministry and the sectors, and how we can collaborate with other related to issues. So we talking about the dimensional of disaster resiliency will take all sectors in the nation to work out together in everything with C word. And the third is about how we can say about risk communication. You can put another C there, risk communication, but with R, Raditya. No, just kidding. So risk communication is how we can say about public trust. Yeah. It's very important to have a public trust, because first, if there's no trust, if you build the trust, you mentioned this, somebody's mentioning about the trust itself. Building the public trust is not so easy, takes years. But if you just mention one issue that related that people doesn't trust you anymore, it will take many years to bring public trust is very important issues in risk communication. And about risk communication, we have to have a data that give information that give analysis that give strategy that will be a knowledge. So this triangle will be giving one of the issues on how do we build from data information analysis strategy into knowledge. So I think risk communication is very important issues to give to the public and to give a public trust. And all this will be as a change behavior, like maybe Ibu Adelina Kama mentioned that, or Ibu Prof. Fatma mentioned about that, about the behavior change. This is our homework. What does it mean if we give risk communication to the public, but it doesn't change anything? Living harmony with disaster, is this just an icon, or can we deal with this harmony, living harmony with disaster? So I think the issues is how we can create this three all on commitment of the leadership, on the partnership of the model, and also risk communication. So with this, we can bring up to the next GP, and we hope that something will come out from Bali to the world, mentioning about this regional forum related on the issues on learning on to bring the resiliency or sustainable resiliency for the sustainable development for the future, for the next generation, for us, from all of us to all of you, and I love you. So I think this is one of the issues that we can make on the next GP, and we will talk to the UN how we can make this. The second is not only about the GP, if the next year, and Said has mentioned also the APMCDRR, so it's the Asia Pacific Ministry Conference that will be held also with the Australian government, or in that time we attend that in Brisbane, but I don't know, it will be virtually or hybrid, or it will be in person. But these two occasions, it will be one of the issues that we can bring up to the world from this regional symposium. And we can not only as an end game, but this is, I think, a starting point for the future until the nation is really resilience. So we call it sustainable resilience for sustainable development. So I end up my speech, and thanks again for all of you, for all the speakers from Siap Siaga, dari Kementerian Luar Negeri, from the Foreign Affairs, and also Australian government, of course. And thank you for this all C thing: collaboration, cooperation, consultation, coherency, and everything about C. Thank you very much, and I end up my speech. I'll give it back to you, Mr. Oliver. Thank you very much.
Raditya, wow. Thank you so much. That was amazing. Just in terms of pulling everything together for us and helping us to give us a bit of a framework to think this through. Really, really strongly appreciated. Very inspirational. Great guidance. Thank you so much. Okay, I think we basically we're 1 minute over time, which is pretty good considering we started at 10 o'clock this morning. So really, from my perspective, it just remains for me to say thank you very much indeed to the governments of Indonesia and Australia for driving this lessons learned process through the Siap Siaga program. A huge thank you to our 6 authors who took hours and hours of their time to prepare these incredibly useful papers and PowerPoint presentations, which have formed the basis, I think, not only for us to kind of think today, but certainly to support us on the outcomes of the next phase of this lessons learned process. I also, if I can just say thank you very much indeed to my colleagues at the Siap Siaga program, who've really helped to drive today, have supported us on today, helped us to organize and hold this symposium. And of course, to everybody else who came, who gave their time, who helped share their lessons with us and listened, and hopefully can take away some thoughts which are useful to you. Hopefully this was a good learning as well as sharing exercise. As I said, in terms of the next steps, we will be sitting down tomorrow morning and starting the process of thinking through how do we shape this up? How is this going to look? Raditya, thank you very much indeed for confirming that the Indonesian government is going to make representations to UNDRR about having a side event where we can tell the story from this part of the world. That's brilliant and amazing news. Thank you very much indeed for confirming that. You have our commitment that we'll have something ready for GPDRR. So thank you everybody for your engagement, for the tremendous amount of information, experience that you've shared, and have a very good, I guess I can say, evening rather than afternoon at this point. Thank you all very much indeed. We'll keep you posted through some email updates over the next few weeks on the next steps. Thank you very much indeed, and goodbye.